Mr. Chairman, we're live on YouTube.
Thank you. Welcome everyone to Senate Corporations. We'll be taking up Senate File 33 today, Physicians Assistance Amendments, Senate File 30, Pandemic Response Review Task Force, Senate File 76, Broadband Development Program Amendments. At least those three. If we have more in our 4-hour window, we will do it. Could we do roll call, please?
Senator Boner?
Here.
Senator Case?
Present.
Senator Nethercott?
Here.
Senator Scott?
Here.
And Chairman Driscoll?
Here. Very good. We're Senate File 33, Physicians Assistance Amendments. If we could admit Senator Baldwin into the room, I will let him walk us through the bill and do the initial presentation on it. I believe he's in the waiting room. I know he's there.
I'm here.
Very good. Welcome, Senator Baldwin. Can you present this great bill for us?
I certainly can. Good morning, committee. It's good to see all your smiling faces. I'll be seeing a lot more of Senator Case's face this afternoon. This is very reminiscent to me of a time several years ago when I was in the House and I presented to a Senate committee. I have those butterflies in my stomach now like I had then. I was presenting to a group of elderly statesmen, very stoic, and not that anybody in the Senate is elderly. Don't take any offense, Senator Nethercott. But it was a very stoic, very serious group. Nobody in this committee was on that committee. My bill went down. It didn't succeed. I'm hoping for better success today. My intention, Mr. Chairman, is to walk you through the bill real quick. There's several other folks in the waiting room who will be able to present this and explain this, the history of this bill and the importance of this bill a little better than I can. They're younger and certainly better spoken than I am, but I will present this bill to you. I will present up first is that if this comes to the floor, if this passes committee, when this comes to the floor, I will be excusing myself from voting and declaring a conflict. I truly don't believe I have a true conflict here. It concerns my profession, of which I'm in the process of retiring from. My patients would not let me retire entirely. I was completely off work for a while and then by popular demand had to come back to work for a while. But regardless, if this makes it to the floor, I will be excusing myself from voting to avoid the appearance of any conflict. Nonetheless, I will present this bill to you. I bring this bill to you at the request of my constituents, the Wyoming Association of Physician Assistants, several members who are present with us today and who will be speaking to you. This bill concerns the licensing of physician assistants in the state of Wyoming. There is a national movement across the board to try to change the licensing requirements of physician assistants and how they're licensed, how they practice, and how they go forward. What we have in place now has been in place for a number of years. I don't know how familiar you all are with where physician assistant profession came from. It was in existence before I went in. I was in actually class 25, and I've been practicing for 25 years. So roughly 50 years, a little bit more than that. The first physician assistants were Navy corpsmen who came out of the military, came out of war actually, with some pretty significant medical skills. They'd been practicing advanced medical skills, came back into society with no place to use those skills. One of the things that happened was through a group in the East Coast, they created this new position or a new occupation called physician assistant, in which they utilized the significant and very good skills of these Navy corpsmen and put them into society and became a very integral part of today's medicine and the practice of medicine. That being said, we practiced under a lot of those rules for all those years. And those rules are changing across the United States. As a matter of fact, in the state to the west of us, they have a similar bill, somewhat more complicated bill going through the process. It just came out of the Senate and will be going to the House floor over there. But let's walk through this bill real quick if we can, and then we'll get to some more important testimony. Page 1 is all titles and some of the sections it's in. We're going to be talking about section 33 to start with. On the page 2 and C, you will see that title PA or physician assistant is added into the definitions of practicing medicine. Of interest, note, when I first came into the state of Wyoming, my card to practice medicine or my license didn't say practice medicine. My card said practice, and then it said medicine was typed in on my card, but it was lined out. It was crossed out. It said physician assistants practice. Now, I'm not sure what we practiced, but we didn't practice medicine apparently, which we definitely do practice medicine. And that's one of the things that we want to correct with this bill. Physician assistants do practice medicine, and I think they practice medicine quite well across the state, and I think it's a proven thing now. So on page 2, that's the big change, is to add practicing medicine, both up there in section C, and then down here in 33-26-501, just means a license to practice medicine there on double I. And then the significant changes start on page 3. Up the top of the page in subsection A, this doesn't apply to a physician assistant education program. Those are students, they're not out, so this section doesn't apply to them. And then you'll see there's substantial through the rest of the page strikeouts and just corrections. What this does is talks about a physician assistant practicing medicine as an individual who practices. We remove the under the supervision of a licensed physician and strike out that language that refers to that supervision, and correct it to say a physician assistant is qualified by the individual's education, training, and experience to provide a broad range, et cetera, as it goes through. And then we strike out in the middle of that page, again, the things that talk about the physician oversight or physician supervision, and that is that the physician assistant was limited to the practice of whatever his supervising physician did. Physician assistance programs, as these other physician assistants will explain to you, provide a good background, a good solid education for the physician assistant to practice medicine, specifically to rural medicine, which is what a number of programs are geared toward in general medicine. At the bottom of that page, and I think this is an important part of the bill, it talks about the physician assistant or PA collaborating with or referring to the appropriate member of a healthcare team as indicated by the condition of the patient and the education, experience, and competence of the physician assistant and current standard of care. I will tell you that on any given day, particularly when I was in a full-time practice and working 70 to 80 hours a week, I talked with other members of the healthcare team down the hall, down the street, down the interstate, sometimes in other states, on a frequent basis, daily basis, hourly basis some days. So the collaboration will not change. That collaboration remains, and it's encouraged, and I think this codifies that, and I think that makes this important. The physician assistant, along with all the other physicians, DOs, MDs, advanced nurse practitioners, et cetera, we're all part of a team. And I think that's the important part that this bill emphasizes. The practice of medicine is not an individual sport. This is a team sport. And I think it's important that that be maintained. And I think that that's an important part of all of medicine, not just in this act, but in all of medicine, that it be practiced as a team. And that's a very large team. It's bigger than a football team. It's bigger than a soccer team. It's a huge team. It's all the way from, hospital housekeeping all the way through a neurosurgeon. It's a team, and that's the best patient care is delivered by a patient care team. An important note is that this bill truly doesn't expand the scope of practice of a PA. PAs are going to be practicing the same medicine they've always practiced. It doesn't add any prescriptive privileges that aren't already there. They're already in the books. Interestingly, I got a postcard yesterday, as I bet several of you did, from another organization talking about the prescriptive authority of physician assistants to prescribe contraceptives, I believe it was. This isn't anything new. This is something that they've been doing for years. I've been prescribing medications for a long time and will continue to do so as a practicing PA if this bill passes or if this bill doesn't pass. on page 4, mostly strikeouts except at the bottom. The strikeouts at the top of the page, talking again about the physician practice or the physician assistant practice, just separating that out and making this a physician assistant practice. And then it talks about the advisory board. We have an advisory board with a board of medicine, which is where this profession will continue to be focused at. The board of medicine will oversee physician's assistants. There is currently an advisory board on the board of medicine. This little change in the language on the bottom of page 4 just changes from at least 2 members to making a majority of the members of the advisory committee would be PAs rather than just 2. If that should change and be a larger number than what it is now, we want to make sure that a majority of that advisory board is in the PA profession. And then we'll switch over to page 5. Page 5 is fairly straightforward. It talks about representing himself as a physician assistant. I don't think Wyoming's had a big problem, but I know in some other places they've had a problem, not specifically in physician assistant practice, but in some other professions where people hold themselves out as something besides a physician assistant or besides some other medical practice. And this specifically addresses that. The physician assistant would not represent oneself as anything besides a physician assistant, and you can't do that unless a license is granted by the board. Then there's just some strikeouts, and then at the bottom of the page we talk about prescribing medication. Originally, Zach talked about prescribing medicine as an agent of the supervising physician, and this removes that part of the sentence of physician assistant prescribes independently. And then it talks about shall not prescribe class or Schedule 1 drugs, which nobody frankly prescribes. Those are the experimental drugs. And right now, a physician assistant maintains their own DEA license and prescribes Schedule 2, 3, 4, and 5 drugs. That's a deeper, I think we've talked about that in the past when we talked about opioids on the floor, what those schedules are. When you think about Schedule 2, you're thinking about things like Percocet, Lortab, et cetera. And then the lesser ones, all down to 4, things like codeine cough syrup. Right now, physician assistants already prescribe those. They're licensed through the DEA. They also hold a license through the state of Wyoming, through the Board of Pharmacy, to do prescribing those things as well as other things. And finally, this just goes on to talk about when this act would be effective in July of 2021. On the fiscal note, there was a small fiscal note, and that comes from a decrease in funding due to the decrease in the number of requests to change sponsorships for that physician assistant to a physician. This came from the Board of Medicine. I believe it's $4,600 annually, or $9,200 on the biennium. With that in mind, I think if the committee would like to hold questions until we've heard some of the other testimony, or if you've got questions, I'd be happy to answer them. But I think this will all come into a little better focus when the PAs in the room can give you a little better explanation of where this bill came from. It's not an individual bill. It's happening in several states around the nation. As I said, the state to the west of us is doing it right now. Some of the states to the east of us already have completed. Anyway, Mr. Chairman, that's my presentation. If you would like to hear from the other folks, and then perhaps entertain some questions.
Any questions for Senator Baldwin? Looks like you did a nice job. We see no questions. We'll go ahead and let in whoever's next. I'm not sure who we have on a list. I don't have a list up. So,
Mr. Chairman, if they can raise their hand, I'll admit them if they have if they want to testify.
perfect, because I was seeing 27. There we go. Looks like we got Jim Hutchinson and Eric Cuban both have hands up.
Mr. Chairman, I don't know about this Jim Hutchins guy. He lives a couple doors down from me, and he's kind of a rough character, but I'd give him a minute or two if he's.
I'm not seeing him. We have Eric Cuban in the room. Let's go ahead and go, Mr. Cuban. Welcome to Senate Corporations Committee, and we're on Senate File 33. We're welcome and
Thank
go
you for
ahead
having me.
and kick off.
Can everyone hear me okay?
Mm-hmm.
Okay. So should I just start spouting my spiel to you guys, or do you have any specific questions? Where should I begin?
Introduction.
Okay, my name is Dr.
Yes, sir. Identify yourself and what you do. And
Okay, my name is Dr. Eric Cuban. I live in Casper. I've known many of you guys for years and years and years, and it's a pleasure to see you, and thank you all for doing what you're doing. It's not an easy time at all, and we're all aware of that, and it's a thankless job, so thank you guys for what you're doing. Like I said, I'm an interventional radiologist in Casper, Wyoming. I went to school in Casper, to elementary school, junior high, high school in Casper. Then I attended the University of Wyoming. I got a bachelor's and a master's degree there. And then I WWAMI program. I came back to Casper in 2010, and I've been practicing here since. I practice very closely with my PA, Sean Ficken. And being at Wyoming Medical Center, I certainly practice with nurse practitioners and physician's assistants and all of the different ancillary staff specialties. Sean is my PA, and he's the past president of the PA's Association. He asked me to speak to all of you today. And essentially, the message that I would like to get across is that for better or for worse, in the state of Wyoming, we don't have an unlimited number of physicians, and we have a lot of people who need care. And because we don't have, physicians are not a limitless resource, oftentimes access to high quality healthcare is difficult. And so with that in mind, particularly if we have nurse practitioners who are practicing essentially independently in our state, I really don't see any reason that we shouldn't expand that to the physician's assistants as well. As I said, I've worked very closely with nurse practitioners and physician's assistants. And I can tell you that in my experience, physician's assistants are every bit as skilled and knowledgeable, and oftentimes bring different and better skills to the table than nurse practitioners do. And that I'm not, by no means, please know I'm not demeaning nurse practitioners at all. They do a great job and they take great care of people. But I will tell you that in my experience, physician's assistants are every bit as good or better. And essentially at the end of the day, it comes down to what resources are available and what are our needs and what are our resources. And we just don't have enough doctors to take care of the people in our state. And we need to do what we need to do. And perhaps that means allowing PAs to practice independently and on their own and without the supervision of a physician is the right thing to do.
thank you, Dr. Cuban. Questions for Dr. Cuban, committee? Great job. It's good to see you again. It's been a long time.
It's good to see you too. I'll come and chase those turkeys around with you sometime soon.
Sounds good. Looks like you're walking the walk today. You're dressed for the part.
Yep, they are waiting for me. So I've been delaying things this morning, and if it's okay, if there are no other questions, I'll just run.
Thank you very much.
You bet. Have a good day.
Looks like we have, thank you very much. Looks like we have Mr. Hutchinson on. Please identify yourself, what you do, and just go ahead and make your testimony, please, sir.
Great, thanks very much, Chairman. My name is Jim Hutchinson. I'm a PA in Lander. I work at the Lander Medical Clinic in primary care, where I've worked for the last 8 years. I'm also the current president of the Wyoming Association of PAs. And it's my pleasure to be here with you all today and try to explain some of the nuances of this legislation or the amendments to the existing law. Briefly, the Wyoming Association of PAs is seeking changes to the existing law to try to overcome what has emerged as a barrier to hiring PAs. And this has some nuances to it that I'm happy to explain in greater detail as I go if I'm unclear as I start. But when this legislation was originally written, it was at a time when most physicians were in private practice, and it served them well to hire a PA or 2 or 3 to expand access, to serve perhaps more rural areas, to also potentially increase revenue. What's transpired over the last 50 years since PA has been practicing in Wyoming is that most physicians now are employees. They're no longer in private practice. On the whole, there are still private practices. But as employees, the benefit to them personally to take on the role of supervision over a PA is really pretty muted at this point. We are currently restricted in our licensing to be licensed alongside a supervising physician. And this creates problems for human resources and CEOs for hiring. And we have lots of evidence of that, some of which has been emailed to you. PAs who've struggled with finding work, being told flat out that PAs don't get hired because we're more burdensome due to the administrative requirements. A CEO up in Crook County who manages multiple rural health clinics who basically cannot hire PAs because it's hard to recruit physicians to supervise us. And a letter from a physician in Laramie who also expresses similar concerns. We strongly believe that PA practice matters in Wyoming. We're a vital part of access to healthcare and high quality care. We also strongly believe that supervision should be at the practice level and not something that's legally mandated through existing Practice Act. On a day-to-day basis, my performance, my competency is scrutinized, is measured here in the practice that I work in. And that scrutiny is applied to me by the management, the partners who own the practice, my physician and PA colleagues that I work next to, and most importantly from my patients and their outcomes. I don't think that we arrive at this in some haphazard fashion or thoughtless manner. We've spent the last 2 years evaluating the potential benefit to Wyoming by changing these laws. We have had listening sessions with physicians, with PAs. We've presented at multiple conferences. We've met with the Board of Medicine. We've had multiple meetings with the Wyoming Medical Society. And we feel like we've listened to concerns, addressed concerns. And at the moment, we're really concerned about the future practice of PAs in Wyoming. And ultimately what that affects is access to care for our patients. So just as an aside here in Fremont County, just in the last 6 months, we've had 5 primary care providers retire. We are struggling with covering the patient volume that we currently have. We don't have enough providers to manage patients in the nursing home. In our practice, we have 25 providers. There are 12 physicians, 13 non-physicians, the majority of whom are PAs. We're really struggling with taking on extra patients at the moment, and it's very hard, as many of you know, to recruit any type of healthcare provider into Wyoming, especially rural Wyoming. So the barriers that exist as a result of this legal requirement are really causing problems for us. And these were probably unexpected and unintended when this law was originally written. I also want to make sure that you understand we're not doing this alone. We're following what multiple states, as Senator Baldwin, mentioned, currently in the US, Maine, West Virginia, Minnesota, Rhode Island, and North Dakota have passed similar changes to their Medical Practice Act for PAs. And as Senator Baldwin referenced, Utah is currently pursuing similar legislative changes. I think it's also important to recognize what won't change. What won't change is that PAs will still have rigorous education and training. PAs will still be under the oversight of the Board of Medicine alongside our physician colleagues. PAs will still have to maintain a national board certification, which requires a renewal every 10 years through somewhat arduous testing process, having just gone through it, as well as maintaining our every 2 year, 100 hours of continuing education commitments. So none of those things are going to change. We're not striving to take a larger piece of the pie. Our goal is to make PAs accessible to patients in Wyoming, and currently the existing law is causing an unintended barrier to hiring us. And we look forward to your questions. We look forward to addressing any concerns that emerge. And with that, I'll stop speaking here, and I'm going to hang out through the whole meeting and happy to answer any questions that come up. Thank you so much for allowing me to speak today.
Thank you, Mr. Hutchinson. Any questions for Mr. Hutchinson?
Mr. Chairman.
Senator Scott.
Mr. Chairman, Mr. Hutchinson, you said you're in primary care, so I presume you're all the time meeting new patients for the first time. How do you introduce yourself to them and let them know what you can do and what you can't and what your professional credentials are?
Thank you for the question, Senator. So by regulation through the Board of Medicine and codified in law, we have to identify ourselves as PAs. What I say to new patients is, I'm a PA, I have great training, I have great education. I'm too old to have any pride about what I don't know. And if I reach the edge of my knowledge, I'm going to ask for help. And I think that that should be the tact that any healthcare provider should take, whether they're a physician, a nurse practitioner, PA, or the ancillary services in healthcare, which includes, PT, respiratory therapy, nursing, all across the board. We owe it to our patients to be transparent about our certification, our licensure, what we know and what we don't know. And anything else would be disingenuous and would be putting patients in harm's way.
Follow up, Mr. Chairman.
Go ahead, Senator Scott.
I didn't see anything in this bill that would change that. Do you? Is there anything here that would change the way you present yourself to the patients?
No, not at all. We have no interest in trying to change, misidentifying ourselves in any way. Look, PAs are, we come to the profession largely through other medical services. Myself, I was an EMT before I went to PA school. Other of my classmates in PA school were respiratory therapists, physical therapists, CNAs, nurses. We go to PA school, we're trained to work in healthcare teams, we identify ourselves as who we are, we're proud of who we are, we know our limitations, we understand our scope of care, and I think we provide an amazing point of access to high quality care in Wyoming.
Mr. Chairman?
Follow up, Senator Scott.
Yeah, well, slightly different question. With the way training works these days, when somebody comes out of PA school, and some of the other medical professions, you get a residency or an internship or something like that. Do you have either in the course of your training or after you come out of a training, do you have a year or two of that sort of thing, or do you go right into practice? How does it work?
Thank you for your question, Senator. So briefly, our training, generally speaking, is 24 to 27 months, depending on the program that you attend. The first 12 months of that are largely biosciences, and then the specifics of a variety of content. PAs are trained as generalists, so we are prepared coming out of school to take care of pediatric patients to the patients that I typically take care of who are in their 70s, 80s, and 90s. We then spend a year in clinical rotations, and those are broad rotations from family practice to hospital medicine to surgical to emergency medicine. There are some PAs who pursue additional training, residency type training in a specialty. The majority of us, however, come out of school and enter into practice if we can be hired, and in essence have on the job continued training. And I think that's true for any practitioner. We've hired a new physician within the last year who, for a variety of reasons, our practice decided to put in place some supervision around that provider. I think that that's best done at the practice level and not mandated through a legal requirement. We recognize, WAPA recognizes that concern about new PA graduates is real. And we think that the system that has worked for, at least since the mid-1960s, has worked well and served patients well. Where we're supervised, we collaborate, all done locally. And I think we can stand on our 2 feet with the current method of us getting additional experience after we graduate.
Thank you. Further questions for Mr. Hutchinson? Further
Mr. Chairman.
questions? Senator Case.
Thank you very much, Mr. Chairman. It's not exactly a question, but I happen to know this fellow very well. What strikes me as significant in all of this is that Jim was a community member. He and his wife, they have a family here. They were very engaged in the community, and Jim decided he wanted to continue to serve this community in a different way. So he actually left, obtained his PA education, and came back. And he's employed in the most prominent medical clinic in the region, and in a very collaborative setting. But to me, there's some significance there in that he's illustrative of people that have ties to communities that come back and stay, and and they're doing this because they want to serve the community and maintain that connection. That's not always possible in the physician setting. It's just, there's too many options. It's too expensive. It takes too long. And as we move more and more towards, the rural people exiting really and moving to the urban regions, it just seems that this is one hopeful sign of improving medical access and care by people that are very dedicated to returning and serving their communities. And I think that's just extraordinary. I hope others will comment on that.
Thank you. I've got part of my screen's blank, so Senator Nethercott.
Thank you, Mr. Chairman. And Mr. Hutchinson, thanks for being here, and to speak to Senator Case's comments about your decision to stay in Wyoming and to continue to serve the community. I think that's remarkable. Of note, I'm a co-sponsor on the bill and recognize the importance of access to healthcare for rural Wyoming and the challenges associated with having enough providers in a community to serve it is critically important. Just a couple of quick questions, maybe you can speak to, and if not, that's fine. But are you aware of any of disciplinary actions taken by the Board of Medicine against PAs associated with failure to follow a doctor's supervision or issues associated with what would be removed in this bill associated with that oversight? And can you speak to that at all, if that's a concern, or if there has or hasn't been disciplinary history? And again, if you don't know, that's fine.
Thank you for the question, Senator. Mr. Chairman, the board, the Wyoming Association of PA Board, we actually have, we monitor for challenges that are emerging within the PA practice throughout the state, largely to try to support our PA colleagues. And to my knowledge, there have been no instances, and to my knowledge, which may have some holes in it, there have been no instances where a PA has been misrepresenting herself or himself or not following suit with recommended supervision requests from a colleague physician. I'm unaware of any of those instances. Is it possible that they've occurred? Maybe. I have not seen any disciplinary action come through the Board of Medicine and the updates that they provide with ongoing disciplinary actions. So that's not something I have any awareness of. It's possible that my colleague Jennifer Frary, who's the current vice president of the Wyoming Association of PAs and has been practicing for a little longer than I have in Wyoming, might have a little bit more informed opinion about that, but that's my sense of that.
Thank you. Follow up, Senator Nethercott? Looks, nope. Okay, any further questions for Mr. Hutchinson? Thank you very, very much for what you do, and thank you for your testimony. We all appreciate, particularly those of us in rural communities, it's only healthcare we have. So you are our physicians, whether you call yourself one or not. So thank you.
Thank you, Mr. Chairman.
Ms. Frary, I'm butchering your name, I'm sure. Would you like to testify next?
Yes, thank you, Mr. Chairman. My name is Jennifer Frary, and I'm a physician assistant, and I live in Casper, but right now I practice in Gillette. I work for Campbell County Hospital and work at the walk-in clinic there in Gillette. I have been a PA for almost 36 years, and I've been in Wyoming for a little over 33 years. I really appreciate the committee giving me the opportunity to address you today regarding what I think is a pretty important bill. For full disclosure, as Jim said, I am the vice president of the Wyoming Association of Physician Assistants. We sent out an email to you this weekend to the committee members, that gave kind of the rationale for the bill. And I did draft much of the text for that email. However, today I'm speaking for myself as a practicing licensed PA in Wyoming. So when I came to Wyoming in 1987, there were about 50 PAs practicing there, and most of us were in primary care. Lanny Reimer owned the practice, hired me, and was my supervising physician. And most practices were privately owned then, and that's how PAs were hired. Now there are almost 400 PAs licensed in the state of Wyoming, and we practice in all specialties, which I think is fantastic. We still have an emphasis in primary care, but you'll see PAs, throughout the healthcare spectrum. We've improved the access to healthcare, for the citizens of Wyoming, and we've cared for thousands of patients over the years. And with the passage of time, more and more of the physicians have become employees of either hospitals, the healthcare systems, and not in private practice. And that includes Newcastle Clinic, where I worked, now is owned by Monument Health in Rapid City. I also practiced with Western Medical Associates for 12 years. That practice is now owned by Memorial Hospital of Converse County. And often the physicians aren't making those decisions about what providers are being hired like it was back when I came to Wyoming. In fact, in Gillette, where I work, there are 41 mid-level providers on the medical staff, and only 11 of us are PAs. At Wyoming Medical Center, there's an urgent care clinic that has 9 mid-level providers, 8 of which are nurse practitioners, and only 1 is a PA. And there are no PAs working in their primary care, clinics. And so, we would like to be considered for those appropriate positions with, our nurse practitioner colleagues. One brief thing that I'd like to address is the concerns that you maybe have heard from your constituents in your communities and counties, or maybe from physicians or physician groups. This bill isn't, designed for us to take jobs or create competitions for our physician colleagues. I doubt you can find any community in Wyoming that has too many doctors. The intent is not for us to go out and practice on our own. We're part of the healthcare team, and the intent is for us to continue to be part of that healthcare team. And the Board of Medicine will still regulate us and be overseeing our PA practice. And we are not, and have never as a profession pretended to be or held ourselves out to be physicians or doctors. We're trained to be PAs, and I'm proud to be called a physician assistant. I identify myself every time I walk into a room. I wear my name badge, and I introduce myself, as a PA, and and so there's never any doubt, and if a patient ever has questions, and early in my practice years, people had a lot of questions. They didn't know what PAs were. They didn't know what we could do. And we spent a lot of time explaining, what we do. But I think that we've done an excellent job in sort of educating our constituents, our patients, and other healthcare providers about, what we can do. The Medical Society has posted on their website some proposed language that they want inserted in practice acts that are open, that adds what I think is pretty onerous, and unnecessary language for statute. And I would strongly recommend that we don't add that language. The rules and regs, for the practice and procedure for PAs clearly state, and it's in section 18, a PA shall clearly identify himself or herself by a name tag or other means to differentiate himself or herself from physicians. I mean, I feel like PAs have a great reputation in Wyoming, and that we've worked very hard over the last 50 years by practicing excellent medicine and teaching, everyone about who we are as healthcare providers. I work with 2 great physicians and 4 PAs in my practice, and we practice as a team to provide healthcare for our patients. But I also work with the ER docs, the urologist, the cardiologist, the nurse practitioners, the physical therapists, and all the members there at Campbell County Hospital, to make sure that, that I can give the best care for my patients. I consult with these providers, as Fred and Jim said, on a daily basis. I certainly don't know everything, and and if I don't know, I'm going to be sure to talk to somebody who does know what to do. And we'll continue to do that, even with the passage, of this bill. We're still part of the healthcare team. The need for healthcare providers is still great. And frankly, it's difficult to recruit physicians. So, and this is not a new problem. Mid-level providers have been able to fill, the need for some of our communities and provide quality healthcare working with our physician colleagues. We want to continue to be a viable option to be hired for these much needed positions. And, I think this legislative change to remove the supervising physician requirement would allow us to continue to be part of the healthcare team. Thanks for your time. And if you have any questions for me, I'd be glad to answer any questions.
Questions for Ms. Frary? Any questions? I can't see all the screens, so you can butt in, senators, if you've got some.
Mr. Chairman.
Senator Nethercott.
Thank you. Yeah, a quick question, Ms. Frary.
Sure.
I'm one of the lawyers on the committee, and so I always go to liability concerns. Do the PAs have any additional liability concerns associated with losing that direct supervision from physicians, and any conversations associated with that, just from my own curiosity?
Thank you for that question. And Mr. Chairman and Senator Nethercott, we have, in my experience, we have our own malpractice coverage. Often it is it is with the same company as our supervising physician. And here in Wyoming, it's the doctor's company and UMIA are the main malpractice carriers. But the AAPA, or National PA Association, also does offer malpractice insurance. So I don't think that would change, because there are locum tenens, PAs that can come into the state, and they have, they would have their own malpractice, coverage coming in that wouldn't necessarily be tied, to that supervising physician or that practice that they come to. So we would be sure to have, liability coverage, and likely it would be through the group that we work with. My coverage now is through Campbell County Hospital, not specifically tied to my supervising physician, but through Campbell County Hospital. I hope that answers your question.
Thank you. Further questions for Ms. Frary? Thank you. Appreciate all you do.
Thank you.
Looks like we have Ms. Whitesell next. Are you ready, Ms. Whitesell?
Thank you, Mr. Chairman. Yeah, my name is Julie Whitesell. I'm the Wyoming Association of Physician Assistants President-elect. I have been a practicing PA for 15 years now. Practiced in Wyoming actively for my first 12 years, and then I have been practicing actively down at Colorado State University at their health network for the last 5 or 6 years. I continue to be active and fill in with Dr. Fisher being on my license. She was my supervising physician at her urgent care and family practice here in Cheyenne for about 5 years, and she's been on my license since then, which affords me the opportunity to fill in for her if she needs me, and gives me an opportunity to do some of the legislative side of things and promote Wyoming physician assistantship. I just was hoping that maybe I could read Dr. Haberly.
Mr. Chairman, I believe her connection dropped. Perhaps Mr. Hutchinson may have that same letter he can read.
I thought maybe my connection dropped. Thank you, Senator Baldwin. I do believe we've lost her, and my screen is froze with Mr. Hutchinson's hand up.
It was, and I believe he has that same letter, Mr. Chairman. He can read that to us if he would be so inclined.
Yes, and I'm in the process of trying to pull it up on my computer. So the joys of technology continue here. Allow me a moment to find that for you. Excuse me for a moment.
And Mr. Chairman, I think that Ms. Whitesell is back.
Okay, let's, Ms. Whitesell, you're muted. If you can unmute and go ahead and pick up where you left off. Welcome back.
Thank you, Mr. Chairman. I'm so sorry. My living outside of Cheyenne in the middle of nowhere kind of doesn't afford me the best internet service. I apologize. So I was hoping that I could read Dr. Haberly, John Haberly's testimony letter. He wasn't able to be here today, but he's a family practice doc that practices in Laramie, Wyoming, and had some really amazing, really well-spoken things to say about promotion of this bill. So with that, if I have your permission, I'll go ahead and read that. To the members of the Corporations Committee. Oh, thank you. To the members of the Corporations Committee, as a family physician in Wyoming, I am writing in support of SF0033. I am currently in private practice in Laramie, where I supervise a physician assistant. We are considering additional physician assistants as well. The state of Wyoming has done an excellent job of recruiting and retention of physicians in the last decade. The WWAMI program has helped us improve access to primary care physicians, surgeons, and specialists across the state. Physicians alone, though, cannot completely fill the healthcare needs of our citizens, nor should they. As we seek to expand the healthcare team, physician assistants make an obvious choice to fill that void. Outdated laws, however, add meaningless cost in terms of money and time, and are a needless obstacle for employers large and small to hire physician assistants. To summarize my thoughts, physician assistants can greatly improve true access to healthcare in Wyoming. The current physician assistant supervision laws are outdated, burdensome, and costly. Physician assistants have superior training to other non-physician healthcare providers regarding the needs of our citizens. Healthcare is a team endeavor, and physician assistants have a long history and tradition of collegial, helpful, and efficient teamwork with physicians. Other non-physician healthcare providers alone cannot absorb the entire burden of need that exists in Wyoming. Modernization of supervision laws allows for local practice-specific improvements. Thank you for your service to our state as you consider the best ways to modernize and expand our healthcare workforce. Please contact me with any questions or concerns if you'd like me to expand on these thoughts. So at some point, if we are able to pass our bill out onto the floors, we will do our best to get him in to actually speak to you all about his support of our bill. I have two other things to add, if I may. There was a question to Jim about our new graduates. The one thing I think that's really important that be understood is we have a National Commission for Certification of Physician Assistants, and that national committee requires that we study for and pass a national certification exam before we are able to practice as a physician assistant. That's why we have the C behind our name, PA-C. Additionally, we're required to have 100 continuing medical education hours every 2 years so that we stay up on our knowledge, our ability to treat our patients safely, and our ability to know what our limits are so that we can continue to ask those questions if we feel like we're seeing a patient that we're not completely familiar with what's going on with them, that we do feel comfortable to go ask our physician colleagues and have, like Dr. Haberly said, that collegial interaction. I think that improves our care for patients, improves our safety for patients, and allows patients to stay in their home base without having to travel a long miles to have to go see a physician if something were to happen to the physician, and then only the PA is in that area to see patients. Thank you for allowing me to speak. If anybody has any questions, I'd be happy to answer them.
Thank you, Ms. Whitesell. Questions for Ms. Whitesell? Thank you very much.
Thank you.
Trying to see who we have in the room now. Kevin. Okay. Actually, we got, I can see Chris Schamber. Mr. Schamber, are you ready to testify?
Yes, I am. Mr. Chairman and members of the committee, thank you for allowing me to speak with you here today. My name is Christopher Schamber. I'm a general internal medicine physician practicing primary care and hospital medicine in Sheridan. I sent you all an email on Friday, and hopefully you were able to, hopefully that got you okay and you were able to read through it to get my sort of full comments. I think a lot of my concerns coming in today have already been spoken with and addressed. So I don't have to speak to all of my points in detail. I need to start off by saying that I'm here in full support of the PA profession. I work with a number of amazing PAs. I would have no qualms with them caring for myself or my family. I think a couple of points that have been made so far. I think Dr. Haberly's letter said it great. That of our non-physician colleagues, I think they have superior training to those the other non-physician colleagues of our team. That is not to at all discount the training and the expertise and the what those other professions bring to the table. PAs are great for a couple of reasons. They train in the medical model, similar to what physicians train in. With Mr. Hutchinson described it greatly. You have a year more of basic sciences where you're learning the sort of background, and then clinical medicine. That is opposed to a nursing model where nurse practitioners are trained in. And I think the second piece of it, which is really important, and I'd like to expand on a little bit, is the supervised training that they get, sort of a graduated training with their supervised physician out, after they finish their professional school, I think is very important. I think the same is true for physicians. I would say that I would not feel comfortable having a physician that just graduated medical school without any postgraduate training. I would not feel comfortable having that physician practice medicine. I think the most important part of my training as a physician is my residency. It's long, it's arduous, and it puts you through the ropes. And I think PAs right now go through that when they get in their first practice. And I think all of them would probably agree with that. Certainly the PAs that I work with in my community feel the same way. They start off and you see fewer patients and less complicated patients, and you work up and you get to that point. I think that's a huge benefit to the way things are now. I understand where the legislation is currently talking about the collaborative model and not wanting to dissolve that relationship. And I wholeheartedly agree with that. I hope to be working with PAs until the end of my career. I fear though, that when people like Mr. Hutchinson, Ms. Whitesell, Ms. Frary are at the end of their careers, and we have a whole new generation of PAs coming up, that mentality might not be the same. And I don't know, what does it look like in 10, 15, 20 years or longer? I fear for what that looks like without some sort of a requirement for postgraduate training, because again, I think that is one of the big benefits to, again, physician medical training and PA medical training in this age. I think also it's been brought up a few times that there's been a difficulty in recruiting physicians. What does that look like, again, in 10, 15, 20 years, or even 5 years down the road, when you have a bill that essentially equates 2 years of PA training to a minimum of 5 years or more of physician training? As you all probably know, in the Medical Practice Act, it is required for physicians not only to finish an accredited resident or medical school and get their certification, not board certification, but get their their medical certification, they also have to complete 1 year of an accredited residency. So there are requirements in statute sort of linking a specified time frame for postgraduate training before they can practice medicine. If you would ask me, I don't think that's enough. I think physicians should be required to finish their residency program. I've had experience with a physician who practiced after only finishing 1 year of residency, and I did not think that person practiced good enough medicine. I would hold our profession to higher standards than that. So regardless, it's still in statute, and I think it should be even more onerous to get that certification or get a board certification in the state of Wyoming. A few other things have been brought up. So I think a couple of things that could make this bill stronger. Again, some sort of a required postgraduate training, I think, is imperative. And again, it's linked to my own board certification in this state. So I think it should be able to be linked to other professional certifications as well. And I still believe that transparent language regarding credentials, although I understand that in rules and regs, there is that language, and I have never had a PA call themselves anything but a PA. I still think there's that potential risk down the road. Again, my concern lies in 10, 15, 20 years or more down the road. What does the whole medical field look like? I think that's all I have prepared for now. Thank you for your time.
Thank you, Mr. Schambler. Questions for Mr. Schambler, committee? No question. We do have a question. Well, Ms. Whitesell, I'm going to go ahead and let you do it. We generally don't do questions outside of the committee, but I'm going to go ahead and let you go. Go ahead,
Thank you,
Ms.
Mr.
Whitesell.
Chairman. Now I'm nervous and I'm afraid I'm forgetting what I was going to say.
I'm sorry.
Well, I forgot what I was going to say, so I'm just going to bow out. Thank you for letting me do that, though. I apologize.
No problem. Thank you. Sorry. Any more questions for Mr. Schambler? Thank you. We have Kevin Bonenblust. I'm sure I messed your name up, but welcome to Senate Corporations, and please identify yourself and do your testimony, please.
Thank you, Mr. Chairman, and I think you did a great job on my last name, far better than a lot of folks do. So I'm Kevin Bonenblust. I'm the Executive Director of the State Board of Medicine. The board licenses and regulates practice by physicians and physician assistants. And at the outset, I want to tell you, I did not have anything prepared to present. My board didn't take a position in this bill. It's not the board's bill, but there's no opposition to it either. So it's whatever you decide in the best sense of policy making for Wyoming. I wanted to be here to answer questions. I heard a couple things that I'd like to just elaborate on quickly. And then if there are questions for me relative to the board's administration of this statute and so on, let me know. And the requirement for certification to be that PA-C that was mentioned, actually there is a provision in the board's rules that for 1 year, a PA may practice without that certification, giving them the opportunity when they get out of school to begin working, but then be able to sit for the certification exam when it's given. So there is that exception. It's not an automatic that a PA has to have the certification before they can lay hands on a patient. So just understand there's that difference there. To Senator Nethercott's question about PAs working outside the scope of their supervision, it doesn't happen very often, but it does happen. And a couple of the examples we've had are PAs who have prescribed controlled substances for, in particular opioids, for significant others in their life that weren't part of the practice. The supervising physician had no idea who this person was. And when we asked the supervising physician about the scripts, the supervising physician said they had no idea what was going on. So that happens. It's very rare, but it does happen. Another example is, the way the rules applied is that a PA works within the scope of their supervising physician's practice. We have had occasion where a PA working in an OB-GYN clinic was prescribing medications for a male, which was probably outside the scope of their supervision arrangement. We got that straightened out, but generally PAs don't have those problems. And I will say that the PA practice model is a tremendous one. I personally have tremendous respect for our PAs. And I think that they really fill an important niche in the healthcare world. So this is not to say anything negative about PAs, but that's just kind of giving you some facts. Last is, I'm still trying to figure out how it is that LSO does their fiscal notes, because we did in our fiscal note indicate we would be losing some revenue, not much, based on the fee that would be charged for changing supervising physicians. That's all well and good. What didn't make it onto what you've seen is we will have about $50,000 in IT costs that we can go ahead and meet. We've got the funds to do it. We'd have to B11 it. But that's just so that we can change our systems, because right now our data system is designed where there's that interlock between a physician and a PA, and you have to have those relationships. We're going to have to undo that so that when a PA gets looked up, there's not a question of who is their supervising physician, those sorts of things. That's just full disclosure. It's not anything that should stand in the way of passing this bill. And one last time for Senator Nethercott's question, as far as PAs working outside the scope of their supervision, we've had one or two occasions where a physician tried to claim that the PA was working outside the scope of their supervision in order to avoid liability, in one case for a patient death due to an overdose. And the physician was totally responsible for it. And there was nothing, the board wasn't buying that. They said, no, physician, you were involved, and so on. That's been super rare where physicians tried to throw a PA under the bus. It has happened in my tenure, but with that, if there are any questions either now or as you go forward relative to the board, I'm more than happy to answer them, but thank you for the opportunity to speak.
Question for Mr. Bowenblust. Senator Nethercott.
Thank you, Mr. Chairman. Two questions for the director. One, I'm surprised that there hasn't maybe been even more conversation from the physicians on the topic, because I know that there's perhaps it's my perspective as a lawyer, but there's a fixation and a preoccupation with litigation and liability. And so I would think that this would alleviate many of those physicians' concerns about being responsible for another provider that perhaps they're not direct, they're supervising directly, but they're not in the room. They don't really know what's going on necessarily. And so, but they still would likely be liable, at least that would be my opinion, for any malpractice that a PA would be alleged to have committed. So concerning your fiscal note commentary, I do think that there should be a discussion with malpractice carriers, insurance providers about the offloading of that potential liability associated with PA malpractice or misconduct that I think deserves probably a more robust discussion with your members. And then secondly, related to Dr. Schamber's concern about additional equivalency of residency type training or on-the-job training associated with PAs, is there a commentary about that amongst the Board of Medicine concerning increasing the training required for PA certification licensure?
Mr. Chairman, Senator Nethercott, to your first question about med-mal, the Wyoming Board of Medicine is very much like the state bar in that the state bar really doesn't say much about whether you have to have malpractice insurance as an attorney. It's of course strongly encouraged, but if the approach has been taken in Wyoming, I believe over the years, that if you've got the nerve to go ahead and try and practice a profession and go bear on liability coverage, you're taking your chances. And similarly, the Board of Medicine really doesn't ever involve itself in, are you carrying coverage or something? There are some states that do mandate coverage. We're not one of those states. So I think that your concerns about, maybe physicians offloading some of their potential liability, that makes some sense to me. Although I will tell you that what we've seen over the years is basically if the physician stuck his head in the door and said, hey, how's it going in here? And plaintiff's attorney finds out about that, they're going to get named as a defendant until they get kicked out of the case or whatever. So, and the physicians having the deeper pockets, I think if they've got even a whiff of what's been going on, they'll be listed as a dependent regardless. I don't like it. I just think that's the way it works out. Relative to the on-the-job training, we could. The problem is there's not a residency program equivalent for PAs as there is for physicians, like our UW residency programs in Casper and Cheyenne. So there's really not anything you could add on. And I think that was sort of, historically, I think the idea was it was sort of like a working internship with the first supervising physician. If there's a better way to address that, I don't know. I would maybe defer to the bringers of the bill. Perhaps they've got some ideas. The board will implement what the legislature tells it to. But at this point, I don't know that there's a really good mechanism for us to ensure that somebody does have extra training beyond their 24 to 27 months in PA school and the rotations they've done with physicians. So wish I could give you better answers on both those.
Thank you. Further questions? Senator Scott.
Mr. Chairman, following on what Mr. Bonenblast just said, because I asked the question at the outset about should there be some kind of a training. I think it is important with all these medical professions that you have some kind of a collaborative situation, residency equivalent, some kind of supervision of the practice in those early years. It doesn't necessarily have to be a residency. I think the way, as I've listened to the testimony, the way it is in fact working now with physician's assistants, that it's not something we need to put in the bill. It's going to be the way they do business, just in the normal course of events. But I would suggest to the group, and I would like Mr. Bonenblast to comment on it, if we run into opposition to this out on the floor, or you'd run into it in the second house, and I think we ought to pass the bill. But if we run into opposition over something like this, putting in a requirement of a year or two's supervised practice really isn't going to change the world very much, especially if you don't put a requirement that it has to be by a physician. I would think that being supervised by a more experienced physician assistant, for example, would be perfectly acceptable in this sort of thing. So I'm not going to try to amend the bill. I don't think it's needed, but if we need something because people get nervous and we sense that to pass it, we need something, I would suggest it as a compromise that won't do any harm and might conceivably on occasion do some good. But question for Mr. Bonenblast is, we did something like that, that wouldn't be particularly hard to administer, would it?
Mr. Chairman, Senator Scott, first, thank you for asking that question. I wish that question was asked more often. And I would first off commit to you and to the bringers of the bill that if that becomes necessary, I'll be more than happy to work with you on finding something we can administer without having a huge burden. We have no more desire to weigh things down than anybody else does. So what the solution might be, that's kind of a policy decision, and I would again defer to the bringers of the bill, but I certainly would commit to working with you all to make sure there's something we could administer and make it work and not be onerous.
Thank you, Mr. Bonenblast. Further questions from the committee? Further questions? Okay, thank you.
Thank you.
Looks like we have Ms. Bush waiting. Welcome to Senate Corporations. I also know you have a couple of amendments, so we'll have you do your testimony. You can kind of lead in, and we won't bring the amendments in until we work the bill, if that's okay, and we'll keep you in the room, Ms. Bush. Thank you very much. Welcome.
Thank you, Mr. Chairman. Good morning, members of the committee. Sheila Bush with the Wyoming Medical Society. As you have heard this morning, from various physician members of the Wyoming community, our membership is a little divided on this issue. And because of that, we are neutral. And so I want to make sure that I start any of my comments with echoing the previous testimony in our support of PAs, our support of their profession. And we believe that in light of patient safety, that care is best delivered when all the professions work together. And so we have an obligation as a membership organization to do all that we can to foster healthy relationships between all of the professions. And PAs are a member of the medical society. As you all know, we represent physicians, but we equally represent PAs. And so that's important for us that you understand. Any of my comments are meant to be supportive, although we are neutral in our formal position, given the division of our individual members. The medical society is not here to stand in the way or do anything to harm the future success of this bill. With that, I do have some comments about an amendment that I have submitted to you, and I know Chairman Driscoll has asked that I maybe save those comments until a little later. So I'm happy to do that, but I do want everyone to know that that language is intended as a universal, sort of as each profession opens their own act, to consistently embed that language across all licensure acts. As we move into this next sort of era in Wyoming, with taking down some of the perceived barriers in access to care, and then in light of doing that and out of respect for that intent, putting a little bit of transparency requirement around that. As was stated before, some of this language does live in different ways throughout different practice acts. And so sometimes it's in rules. The language that was mentioned earlier about name badges is not in statute, it's in rules. And in other professions, it does live in statute. And so our intent is just to streamline that, and for as much as is possible, put consistent language across the practice acts in order to just elevate that conversation and empower patients to make really educated decisions about their care. And with that, I'll save any other comments about that specific language for later, Mr. Chairman.
Questions for Ms. Bush? Seeing none, I think we're through with everybody that's here. If we can get hands raised in the waiting room, we can go ahead and admit some more people if we have more testimony. I see some people I know in there that probably are going to want. I see Representative Summers is there. I don't know if he wants to testify. We have my local PA, Bob Cummings, and I see we have Franz Fuchs in from Department of Health. If we can, Representative Summers, welcome. We'll jump you right in if you have anything for us.
Mr. Chairman, thank you. I'm waiting for another bill. Thank you.
Okay, I knew you, busy day for you. I wanted to get you in. Mr. Cummings, who is, by the way, my neighbor and is our, for all practical purposes, the face for healthcare in our community. Are you available, Mr. Cummings? He's still muted. Let's go ahead and go to Mr. Fuchs with Department of Health, and then we'll come back to Mr. Cummings.
Good morning, Mr. Chairman, members of the committee. My name is Franz Fuchs, Policy Analyst, Department of Health. I was just here to let you know that the department does not have any concerns with this bill.
Any questions on the short testimony? Thank you. Mr. Cummings, are you available? We've got him on the screen, but he's muted still. Okay. We have other people in the waiting room. We'll wait a minute on Mr. Cummings again. Do we have other people that are wanting to testify? If you can raise your hands, okay, I see nothing coming. Does anyone know of anyone else that wants to testify? I see we've got Mr. Cummings in the room. If we can get him unmuted, one last try. Okay, we got to love our technology. I think if that's the case, we're through all of the public testimony in committee. I'm going to go ahead and let someone in if they come in, but I think we'll go ahead and end public testimony for all practical purposes. If someone can get in, we'll get them in, and we'll move to the committee on the bill. Committee, what is your pleasure on the bill?
Move the bill.
Thank you. Bill has been moved. We'll go to discussion. Senator Nethercott.
Thank you, Mr. Chairman. Just for purposes of moving the conversation along, probably is the discussion of the Medical Society's proposed amendment. I think that was emailed to us. And so interesting conversation that we have had today. Trying to get to my email here.
There's a pair of them, Senator.
There is. So just wanted to bring it to the committee's attention so that potentially we can start discussing those proposed amendments. Otherwise, it's my sense that there's probably some support for the bill here. So, interested to hear from the other committee members about the need to put it in statute as opposed to what we've heard, some of these concepts associated in their rules. So maybe invite that particular conversation about the need to further amend that for a policy decision from this committee to make it statutory or keep it in their rules.
Yeah, I think the conversation's appropriate at this point. The amendments are there. Does everyone on the committee have the amendments? That's probably the first thing. If not, we can probably screen share them. Senator Scott, do you have them?
No, I do not. I probably got them somewhere buried in my email pile, Mr. Chairman, but I haven't found them.
Okay. We can probably either read through them for you, Senator Scott, because we ought to have the discussion. So I will go ahead and read. Is that okay with the committee? The first one would be new section WS 33-26-513, small a, advertisement for healthcare services that names a healthcare practitioner provider must identify the type of license held pursuant to the definitions under the Licensure Act. The advertisement shall be free from any and all deceptive or misleading information. Small Romanet B, a licensee providing healthcare service in this state must conspicuously post and affirmatively communicate the practitioner's specific licensure as defined under this act. This shall consist of, but not be limited to, the following. Number one, the healthcare provider shall wear a photo identification name tag during all patient encounters that shall include little I, a recent photograph of the employee, little I, the employee's name, 3 little I, the type of license, and IV, the expiration date of the license. Name tag should be a sufficient size to be worn in a conspicuous manner as to be visible and apparent to the patient. Number 2, the healthcare practitioner shall display in his or her office a writing that clearly identifies the type of license held by the healthcare practitioner. Writing must be a sufficient size as to be visible and apparent to all current and prospective patients. Little c, a licensee who practices in more than one office shall be required to comply with his requirements in each practice setting. D, healthcare practitioners working in non-patient care settings and who do not have any direct patient care interactions are not subject to the provisions of that act. That's the full of it. I think we will let Ms. Bush go ahead and elaborate any further if she'd like to on this amendment, and then the committee can discuss it. Ms. Bush.
Thank you, Mr. Chairman. So for a little bit of context, the Medical Society has been in support of language like this for over, well, just right at 10 years. In 2011, we ran a bill that was a little more comprehensive and was a standalone effort. And it was defeated in that session. And so we just feel like in the last 10 years, as I've mentioned, some of this lives in rule now. And we think it's good practice. We think it should apply to physicians the same as it should apply to any other healthcare provider in a world in which patients are asked more and more to make difficult decisions about their care. And so while some acts have and PAs have the name badge requirement in rule, there isn't anything around advertising. And so we do have examples around the state of some other providers making statements around the care that they're able to provide to patients that isn't always within their scope. But more than that, they don't clarify who they really are. And so this is just our effort. We don't intend any of this to be contentious or overly onerous in any way. It really is just an effort to sort of raise the bar and say everyone in the healthcare profession and on the team should meet the same standard. And that standard should be around disclosing your training and your expertise to a patient when they're making those decisions.
Thank you, Ms. Bush. Questions for Ms. Bush or discussion on the amendment? No further discussion at all. Would someone like to move the amendment? Senator Scott.
Charlie, you're muted.
Still muted, Senator Scott. We're waiting for you to unmute. We'll get you there. There we go.
Okay.
Welcome, Senator Scott.
Okay, this thing. The question I've got for Ms. Bush is when on the name tag part of it, I don't think it applies to this particular group, but I've never heard of anyhow of a physician assistant who had a doctorate in some related field. But where you've got, say, like with nurses, where they do sometimes get doctorates, and would there be any reason they couldn't put Dr. So-and-so on the name tag, or would that be regarded as claiming they were a physician when they weren't? How does that work with that kind of language with these amendments?
Mr. Chairman. Mr. Chairman, thank you. Senator Scott, I believe you've touched on a key piece, which is the term doctor is an academic word. There are individuals who attain doctoral level education in a variety of professions, as well as many outside of healthcare. And so the term physician is what really delineates right now someone who has attended medical school or is a doctor of osteopathy from everyone else on the healthcare team. I don't believe, and it is not our intent, to prevent anyone who holds that doctoral level education from putting that on their name badge or anywhere else. It is in no way our intent to strip anyone of that ability to disclose that attainment of education. It's just our intent that if everyone has a doctoral level education within the healthcare team, that we present to patients a way to delineate and understand the difference among a lot of the professions. And so that name badge could very easily say Dr. Sheila Bush, and then underneath it would need to show what is a doctorate of. Is it a medical doctor? Are they a doctor of osteopathy? Are they a doctor of chiropractic? And so it's in no way intended to strip someone of the right to say doctor if that's a level of education they have achieved, but just to be very transparent and clear about what that doctoral training is in. Did that answer your question?
Thank you. Further questions for Ms. Bush, or do we have someone who would like to move the amendment?
I'll move the amendment.
Okay. Amendment has been moved. Discussion. Senator Scott.
Mr. Chairman, the question I've got is for the assembled physician assistants here. Does this language do any real harm to your bill? Do parts of it create any special problems for you?
Mr. Hutchinson, were you raising your hand?
Yes, sir. Thank you, Mr. Chairman. Senator Scott, I think it's a great question. I think as Sheila Bush, who I know well, we've worked together on a lot of projects. It's great to see you, have spoken about, this, in some ways, this amendment is duplicative, at least for PAs, with what's already codified in the regulations through the Board of Medicine, where we're required to identify ourselves as PAs, we're required to wear a name tag. I've got mine on right now because I'm going to go and see patients in a little while. I think the concerns I personally have, not necessarily representing WAPA at the moment, are that we are now legally requiring, and therefore if I lose my name tag or show up to work without it, or it gets damaged, I'm now in violation of a law when I still need to see my patients that day. The other piece of the amendment, I believe as written, was the piece about posting the hours of available supervising physicians. And at least in my practice, that will be a very onerous administrative burden on our practice to try to place a posting of available hours for physicians. So that piece, I think, presents challenges. And if you speak to our CEO, Mr. Ryan Hedges, he will echo those opinions of mine. Not because they're mine, but because he shares them. And I think that, I agree with Ms. Bush's opinions and comments about misrepresenting ourselves, because it is complicated when patients come to a clinic and they don't know who they're seeing or may not have met them. There are times where there's confusion about the roles that each of us play. I'm up for equitable requirements across the board for all providers, not just for PAs, nurse practitioners, or others, but also including our physician colleagues. But I do think that that's a rather onerous ask of clinics and practices to post hours of available physicians in the practice.
Thank you, Mr. Hutchinson. Ms. Bush.
I just wanted to clarify, Mr. Chairman, my apologies. I wanted to clarify that the language that we sent, because we are truly trying to be very good partners with our PA colleagues, does not include any of Section D. That was removed. And so PA Hutchison, some of your testimony may be confusing to members of the committee. That language was not in what was sent to them. So that was a former Section D that is not in there. In our spirit to really meet the needs of the PAs, that has been removed. And so now D is just a section that says it doesn't apply to anyone in an academic or non-patient setting. So I apologize for that.
And if I may, Mr. Chairman, Sheila, my apologies. I actually have not seen the amendment. All I saw was the draft through the advocacy letter. So my apologies if I overreached there. So I'll take that piece of my testimony back.
Perfect. Senator Baldwin, did you want to have a comment or two? Very good. I think we're good. Any further discussion on the amendment? Any further discussion on the amendment? Okay, the amendment's been moved. Looks like we're question being called. All in favor of the amendment, raise your hand, please. I see. Okay, we have two, and with myself, it makes three. The amendment's passed. We're on to the second amendment. I've got to pull it up real quick.
Mr. Chairman, how did a gun bill get in the middle of this?
A gun bill?
The Second Amendment.
All right. I'm a little slow today. I'll admit it. You got me. I'm laughing, not very loud though. Okay.
Welcome to my committee.
Well, that's only myself can bring a Second Amendment bill to corporations without noticing it. I'm sure it'll go good. Okay, the second. New section, Wyoming statutes 33-26-513. Small a, an advertisement for healthcare services that names a healthcare practitioner or provider must identify the type of license held pursuant to the definitions under the Licensure Act. Advertisement shall be free of any and all deceptive or misleading information. Oh, is that the one I just read?
Yes, Mr. Chairman, I think so. I don't think that there are two.
Yeah. Well, there's, okay, came twice, one amendment, so we're done. My apologies to Ms. Bush. I pull up the second one and I start reading in it. It's seems like it is a Second Amendment one. So, all right, so we're back on the bill committee. Discussion on the bill.
Mr. Chairman.
Senator Nethercott.
Thanks, if I may. On the amendment, you know, typically it does seem a bit onerous from a statutory perspective, but I understand, and having served in the legislature now for a period of years, just how painful these practice acts can be, and not wanting to experience any more of those in the future. I would like to be respectful of compromise and efforts to work together, even if it's not perfect or maybe not necessarily appropriate in statute, but recognizing where the conversation is going with an effort to have more meaningful and productive conversation concerning the practice acts. I'm going to support this compromise and this effort between these professionals as they work towards providing medical care to Wyomingites.
Perfect. Further discussion on the bill. Further discussion. I'll do just a tiny bit, and it's probably not very necessary, but mine is along the lines, I thank the sponsor for asking me to be a co-sponsor on it. Our physicians assistants in our community, as I said, are our healthcare community. We live with them, and I thoroughly appreciate all they do and what it does, and anything we can do to help them do a better job of what they do, I'm all in for. And I think this bill's a great bill and a necessary one. And I thank Senator Baldwin for bringing it. With that, any further testimony? Okay, question being called, roll call on Senate File 33, Physician's Assistants as amended.
Senator Boner.
Aye.
Senator Case.
Aye.
Senator Nethercott.
Aye.
Senator Scott.
Aye.
Chairman Driscoll.
Aye.
Okay, Senate File 33 passed as amended.
Thank you, everybody, for their testimony. Great bill and great job, Senator Baldwin. Thank you. Would the committee like to take a 5-minute break? We've been at it pretty good. So it is now 10:06. Let's go to 10:15. We'll come back in, please.
I know you open the door or something there.
quickly before we get on, Senator Nethercott, who should be carrying this bill? This is a committee bill, this pandemic review task force.
Mr. Chairman, you know, I think anybody can carry it. It's a pretty simple bill, really. So whomever would like to volunteer, if not even potentially the former corporations chairman, Senator Landon. Call him out on the floor.
I don't see him in the room. We were a little short on him, so it's probably, I would guess yourself or Senator Case.
Yeah, no, that's fine.
Okay,
That's fine.
I'm sorry to keep putting you guys on the spot, but I wasn't here and I'm not, I've got no background on these.
Nope, absolutely.
So, and I know we've got testimony on it, so I think we'll just go ahead and roll into it. Senator Case isn't back on, but he obviously is up on it. We're going to be a little pressed for time, so if you want to take up Senate File 30, which is the Pandemic Review Task Force, we'll start into it. Start down the path, please.
Mr. Chairman, did you ask me to proceed with explaining the bill?
Yeah, thank you. Sorry. Can you do that? If you
Yeah,
will,
absolutely.
I'm going to have you go ahead and work us through the bill and do testimony.
Absolutely, Mr. Chairman. So this bill obviously is the work of the Joint Corporations Committee from the interim, and it's the Pandemic Response Review Task Force. As we're all aware, we're currently experiencing the pandemic, and 2020 was particularly hard for Wyoming. As a result of a lot of those conversations and frustrations surrounding the way the pandemic has been responded to and understanding how we should move forward in the future to potential future pandemics, is really to create a task force to kind of do a postmortem on how the state has handled the pandemic in ways that we can move forward to improvements. And that really is the purpose of the bill. There was a large amount of support for the bill and a lot of desire for broad-based participation with the task force. And so as we move through the bill, you know, it's the creation of the task force itself on page 1. And then starting on the bottom of page 1, moving through the following pages, identifies all of the different stakeholders that would be members of the task force. So walking through that, page 1, line 14 through 15, one representative of the Department of Health appointed by the governor. So that makes sense. One person by the Department of Health appointed by the governor. Page 2, lines 2 through 3, one representative of the state's K through 12 educational community appointed by the governor. As we know, our school systems were also impacted by the pandemic and continue to be. The next is, we're on Romanet 3, one representative of the state's business community appointed by the governor. Again, as we know, as a part of some of the health orders and the governor's orders, many of our businesses were required to shut down or reduce operations. So we definitely want them to be at the table. Moving through, one member of an association representing county commissioners appointed by the governor. Again, as we know, county health officers also played a strong role in responding to the pandemic and issuing orders, and the county commissioners' roles in that. So ensuring that the counties have a place at the table. Moving through, Romanet 5, one enrolled member of the Northern Arapaho Indian Tribe or Eastern Shoshone Indian Tribe appointed by the governor. Again, as we're aware, the tribes experienced the pandemic at probably a more extreme rate, I think the data indicates, than the rest of the state, and have experienced more deaths. And so certainly having our tribal partners be at the table is important. Romanet 6, 2 Wyoming healthcare practitioners whose practice includes seeing patients appointed by the governor. I think this one's particularly unique, where it's not necessarily a government official or someone in government, rather real doctors on the ground who experience treating patients and what their experiences were and how those experiences can help the state respond in the future. Bottom of page 2, Romanet 7, 3 members of the Wyoming House of Representatives appointed by the Speaker of the House. We can't have too many legislators, right? I mean, the rest of these folks, just 1 or 2, but legislators for sure, we'll have plenty of those. So 3 members of the House and 3 members of the Senate appointed by the Senate President. But I do think it's important that if this task force moves forward with creating some type of legislation, we do have the requisite number of legislative members who have been elected by the people to make those types of recommendations for future legislation, if that's what comes out of the task force. What the task force is intended to do, going on to line 6 of page 3, the task force shall study the state's response to the COVID-19 pandemic and the state's ability to respond to pandemics in the future. And specific identified areas for study. Do we need to change our statutes currently on the books or moving forward? The authority granted to state and local health officers. We know there's a lot of controversy surrounding that. I think we have bills currently in this particular session dealing with that. One of the motivations behind this bill was really to do this thoughtfully and evaluate it effectively. And this is one of the purposes behind the bill. The distribution of statutory authority provided to the Department of Health. The effectiveness of public health orders. Certainly a topic of conversation globally. Moving on to the next page, which I think is particularly important, consistency or inconsistency of local health officer efforts to mitigate the spread of the disease. So I think an interesting thing for the state of Wyoming when we have differences in counties and differences within the state response. And so how do we navigate that moving forward, or what stumbling blocks did we face associated with those different officials? Law enforcement's role as well. Again, the businesses, schools, and then the task force's purpose, again, rounding out on the bottom of page 4, is to provide solutions and understand what we did wrong, what we can do better, and how we can make sure that the state is in a position to navigate this in the future. There is an appropriation in section 2, bottom of page 5, $10,000 from the general fund for compensation mileage per diem associated with the task force. Moving down to page 6, there's another appropriation of $50,000 to LSO for the LSO members who would be tasked with serving on the servicing the task force. So it looks like a total appropriation of $60,000 for this task force. With that, Mr. Chairman, I'd stand for questions.
Any questions for Senator Nethercott? Seeing none, we will move on to testimony. I think we probably have some. We've got an attendee with a hand up, which I'm not seeing. Jim Willix, welcome. Mr. Willix.
Thank you, Mr. Chairman. Appreciate the opportunity today. Thank you, Senator Nethercott, for kind of walking through the bill. I am Jim Willix. I am president of the Wyoming County Commissioners Association and a Commerce County Commissioner. The Commissioners Association stands in support of Senate File 30 in this task force. And actually, we stand in support of it in lieu of the other bills that are out there, because we believe the comprehensive approach to studying the response to the pandemic is a better approach than the half a dozen of bills that address a portion or part of it. But we really believe that the task force is the best way to approach this and stand in support. We'll be monitoring the other bills, but believe this is the right way to move forward. You know, there's no doubt that healthcare workers were on the front lines of the pandemic response in regards to care and treatment of those that infected. But I would argue that the commissioners and counties were on the front line of the policy. We were the county commissioners and counties, we stood up incident commands that had to respond to the pandemic, working with our emergency management. Public health orders were implemented at the county level by the county public health, which in most time is a blended office of both state and county employees. We helped draft variances and submitted those. We held public meetings, issued press release, and answered questions at all times and places. Counties were in charge of delivering the PP&E to small businesses and to nonprofits, and we were also in charge of the enforcement. All of this fell to counties and commissioners. All of this while still conducting the regular business of the county. We held court, we licensed vehicles, we collected taxes, issued marriage licenses, approved subdivisions, among all the other things that counties do. This task force is taking a comprehensive and significant investigation of the pandemic response, and we support that. You will note that in the 23 counties in Wyoming, there were probably 23 experiences. And I would suspect in the 90 legislative districts that we have, the 30 in the Senate and the 60 House, there were probably 130 different responses there. I mean, I'm doing my math right today. That'd be 150. Sorry, Brian's laughing at me because I can't do my math. But I think here in Commerce County, I would argue it worked exactly as it should. And you only have to look at news reports to see in other counties, it was disjointed and contentious. I lay out this background for two reasons. One, to show you and provide evidence of how engaged county commissioners and counties were in the response. And second, to make a request of this committee. Due to the hands-on nature of counties and commissioners and the various experiences we have, the WCCA respectfully asks that you add another commissioner to this task force. One commissioner cannot adequately reflect the experiences and the various opinions of what happened on the ground that we were charged with implementing. It would better represent the experiences and add value to the discussion. It also would give the committee a true representation of the issues faced and would give a broad representation of the possible solutions. So again, we're in favor of Senate File 30, and we respectfully ask that you consider adding another commissioner to this board so that it more broadly represents the boots on the ground that implemented many of those issues that came forward to us. And with that, Mr. Chairman, I would gladly stand for questions and appreciate this opportunity.
You're muted, Mr. Chairman.
Questions for Mr. Willix? Senator Boner.
Thank you, Mr. Chairman. Just regarding the beginning of Commissioner Wilkes's comments on the myriad of other potential solutions that may or may not be before the legislature here sooner rather than later. I appreciate the sentiment that obviously, this is much more, lots more thought out, more, I guess, reflective approach as opposed to trying to make changes as we're dealing still with the pandemic. I just want to make clear this, you don't see this bill necessarily conflicting with any of those other proposed solutions. This could be taken up as more of a long-term, looking at a long-term fix and not necessarily mutually exclusive with supporting any other proposed changes to health order policy. Would you agree with that, or?
Commissioner Willix, would you agree with that?
Thank you, Mr. Chairman. Senator Boner. What the County Commissioners Association has done is this is the only bill we are supporting that deals with the response, other than there's a bill out there about expanding the pool of public health officers. Other than that, we are monitoring everything to see how they progress, but our membership likes bits and pieces of bills and dislikes bits and pieces of bills, and that's why coming back to that comprehensive. Today, we are only monitoring all the other bills and stand in strong support of this one.
Thank you. Further question, Mr. Willix. Thank you. Senator Nethercott.
Thank you, Mr. Chairman. I actually heard your testimony, Mr. Wilkes, is saying that you prefer this bill in lieu of all of the others.
Yeah, in lieu of today, and I guess it depends how you interpret. We're monitoring all the others. We did not support or oppose the other bills. We are monitoring them, but we do believe this is the correct approach today, is the comprehensive approach to looking at that. So we're monitoring to make sure they don't go down a path that changes our position. So it's, and for those of you who don't, we have to get 2/3 to take a pro or oppose. And we are monitoring the others, but we believe that the comprehensive approach is better. And I'll be honest, I don't know if we would reach 2/3 agreement on any of the other bills because of the diverse experiences that we had. And I think that's why it's more critical that the commissioners have a broader representation on this task force, because we really were the ones on the ground that had to implement the public health orders and deal with the issues in our communities.
Further questions for Mr. Willix? Thank you, Commissioner. Appreciate it. Mr. McKay, would you like to take a bite at the apple?
Mr. Chairman, thank you very much. All the members here of the committee, thanks for your time. My name is Rennie McKay, and I'm Governor Mark Gordon's Policy Director and I wanted to quickly address all of you on behalf of the governor's office and the executive branch, including the Department of Health. Stefan Johansson, Deputy Director, and Stephanie Pyle, Senior Administrator for Public Health Division, are here if there are any technical questions. But in terms of addressing that overarching policy approach for this session, I wanted to speak on behalf of the executive branch for all of them. So before addressing the bill directly, I did want to just touch base on the COVID-19 situation today in Wyoming. So you've got that context, starting with a great story and to build on what Commissioner Willicks just said. The vaccination program is going extremely well, and that's due to teams in the counties. So we've had 80,000 first doses administered already across Wyoming, and almost 40,000 second doses. And that's one of the higher rates of administration in the entire country. So I want to personally thank the Department of Health, the county health departments, and all those private providers that have chipped in to be a part of that. I think this is going incredibly well, given all the challenges, and as Commissioner Willicks said, and I think to the point of maybe why this bill is the right approach, we're still in the middle of this, and we've got people who are working extremely hard today to keep people safe on the ground across Wyoming. The case count in Wyoming right now, we've got nearly 46,000 total confirmed cases. And the good news is we've obviously seen a decrease on that front over the last month. We've also seen a decrease notably in hospitalizations, even just in the last 10 days. So some very positive things are happening right now in terms of COVID, but the pandemic is still a threat. We all know about the variants that are out there and the unpredictability about what can happen. We've still got those people in the Wyoming hospitals, and we've also got people in out-of-state hospitals. And so this is still a concerning situation, and we still have so many people who are neck deep in fighting this and trying to keep the public safe, and also to protect livelihoods and keep businesses open and functioning as well as possible. So when the pandemic is over or in its waning stages, no matter what happens, the executive branch will be doing an after-action review. Additionally, it's typical practice after a public health event for the public health professionals to do an in-depth review of the response and to provide recommendations for improvement for future public health events. Specifically, what the Department of Health does in these hot wash or after-action activities is to dive into some specific ideas. They'll look at preparedness, the strengths, the gaps, the observations and recommendations, and together we'll use that information to plan for future events that may arise and to determine what other preparations and policy decisions need to be made in order to be better prepared for any future responses. So this is all part of the normal process, and we as the executive branch will prepare an after-action report following this pandemic. Notably, there is a pandemic plan that the state has that was most recently updated in 2019. And the most recent after-action review was with the H1N1 virus, and what not only was learned in Wyoming, but was learned globally when that virus emerged. So if the legislature determines that this task force is the vehicle by which to review the state response, from your perspective, the governor's office would welcome the opportunity to participate and to further assess response and develop those recommendations as we go forward. It's our opinion that a review of the pandemic response before changing the statutes would also ensure that we don't get any second order effects that are unintended. So I think, again, to build on what you're all talking about, there would need to be really thoughtful about this, because the statute that specifically named in this bill, 35-1-240, is used in many non-pandemic instances to protect public health. And the state health officers routinely used her authority to isolate and quarantine individuals and close buildings in response to smaller scale events. You could probably all think of a few where that's happened in your community, or you remember reading about them in the media, and they were essential in protecting the public health. So the after action review would allow that can all continue and to make sure that the changes that do come about as we've learned from this pandemic are really thoughtful. I'll just point out probably the most important example of the state health officer's ability to isolate folks is with contagious tuberculosis patients. So that's something that's happening right now, and we just want to make sure we think about all of that fully and get to the other side of this as we review what happens as we go forward, because certainly I think we can all point to changes that would help, and we all are going to strive to do better in the future. So just want to say again, thanks. We think this is a well-conceived approach, and we can commit that there's going to be multiple after action reviews no matter what happens. And again, the governor's perspective is that we need to get to the other side of this pandemic before we consider what changes need to be made to state laws, to regulations, to approaches, and some of those are executive actions. So thank you, Mr. Chairman, for your time this morning. If there's any suggestions, the main one again is they'd ask that the governor's office participates in this task force if this moves ahead. And you look closely at that membership. You may hear from others who have some suggestions. And I think then as you look at the participation, the other thing we just ask is that we align the funding for the per diem for non-state employees and non-legislators so that they matches up as we go forward. So thanks, Mr. Chairman. Any questions that you have, again, I'm here for you to talk policy. If there's any technical questions, we do have the folks from the Department of Health nearby if you want to ask them any questions.
Senator Nethercott, questions for Mr. McKay.
Thank you, Mr. Chairman. Mr. McKay, I mean, the governor's office has identified that every single one of these appointments is by the governor, correct?
Correct, Mr. Chairman.
Further questions for Mr. McKay? Further questions? Thank you, Mr. McKay. Do we have further people in the waiting room on this issue, this bill?
Mr. Chairman, no one has their hand raised at this moment.
Okay. With that, we will close public testimony. Committee, what's your pleasure on the bill?
Move it.
Senator Case moved the bill. Discussion. Senator Scott.
Mr. Chairman, I've got several things I want to say about this bill. I think it is necessary, Mr. Chairman, that we have some kind of a review that's probably broader than just the professional after action report. And I had thought initially that it was best handled by a legislative interim committee. I think in general, we're using too many of these task forces, but I think maybe this one, as this thing is dragged on and we've seen the full scope of it, I'm starting to warm to this approach of a broader task force. I would make several points about this. First one is, I would say very bluntly, I think that given the amount of uncertainty there was, particularly at the outset, as to what we were dealing with and how bad it really was and what its characteristics really were, I think our governor and our state health officer and most of our county health officers did just a bang-up job in responding to what was a very confusing situation for quite a while. And especially in the early stages when we were needing to buy some time so that we really could learn what worked and what didn't with this one. So my compliments to all those officials. You know, they didn't get everything right. They're human. What do we expect? They were dealing with a lot of uncertainty. I think that it is important in part because I will guarantee you there will be another pandemic. It may come. The last big one we had was the 1918 flu outbreaks, so-called Spanish flu, had nothing really to do with Spain, but that's how it got named. That was the last really big one. Goodness knows how long the next one will take, but we'll get it sooner or later. And Mr. Chairman, I have several concerns in the bill. I'm not quite sure how they could be changed. But I think one of the things we need to keep in mind in doing this is the one thing I'll guarantee you about the next pandemic, in addition to we will have one, is it will be different from this one. And some of the things that would have made sense if we'd have known all the characteristics of this one, some of the things that would have made sense in our response to this one may not make sense in the response to a future one. If you get one, Mr. Chairman, that is a good deal deadlier or more contagious, you need a different response than what we had this time. Or one where it's a lot harder to get a vaccine than proved to be the case this time. So I think we need to keep that in the back of our minds as we look at the legislative end of this. What do we need to do in changing our laws? Because it is going to be different next time, and some of the response is going to have to be different. The second thing I think we need to be very careful is to avoid the temptation for political grandstanding based on people who don't agree how this one was handled and are looking at it with 20/20 hindsight. Going into this, the officials having to deal with it really didn't know a lot of the fundamental things about what this one was like. Nobody did. It took us a while to find out. So, Mr. Chairman, those are my reservations. I don't know that you can really change the bill to answer them, but I think in dealing with the results, we've got to consider all those things because it will be different next time, and it probably at the outset we will not know what we're dealing with, like happened this time. So, Mr. Chairman, I think this is an important bill, and I think we need to. I think the timing is going to be right. I think it'll be over so that we can start to be dispassionate about it, which might be a difficulty right away.
Thank you, Senator Scott. Senator Nethercott.
Thank you, Mr. Chairman. I too share Senator Scott's comments. I agree with them wholeheartedly. In response to the commissioner's request, I do think that request is reasonable. I've had concerns about the bill of having the task force to be too large and too unwieldy. That's my experience in most things. The larger it is, the less productive it can become. But there's real truth in the fact that the commissioners and the counties carried the brunt of this as a result of our statutes. And I think that they will and probably should in the next pandemic as well, as a result of the differences in our counties. As somewhat absurd as that is, that there would be a significant difference between a county, because a pandemic, a virus certainly doesn't know the difference between a county line. But nonetheless, that's how our state operates. So I think that request is reasonable, and it's something that I'd like to move on the committee with. So on page 2, line 8, to add 2 members of an association representing the county commissioners. I think that's fair, and I think the acknowledgement that there's differing views throughout the county, the 23 different experiences is identified, is important to understand. So with that, Mr. Chairman, I'd make that motion to change it from 1 to 2, page 2, line 8.
Thank you, Senator Scott. I see you raising your hand. I see, looks like Commissioner Willicks is smiling. Senator Scott.
In support of that motion, yes, the virus isn't different from one county to the next, but the problems that you have with it can be quite different depending on, for example, Teton County, Park County with their tourist business bringing people in, that makes quite a difference. With Cheyenne being close to Colorado, and this one was more trouble, and probably a future one will be more trouble in a big urban area such as we have south of us. That makes a difference. The larger the community in some ways, the more likely for difficulties. So you do have quite a bit of local variation in the response that you're needing. The response in say Johnson County is probably doesn't need to be as fierce as the response in Natrona County just because of the population difference and population density difference of the towns. So, Mr. Chairman, having a couple of people from the counties so that you get some flavor of the differences in the experience that the different counties had, I think might be very important as we talk about the need going forward for local flexibility, and maybe we need to put in statute some of the waiver provisions that they sort of made up and used right on the spot that did seem, I thought, to work, tailoring responses to the particular problems that or lack of problems that different communities had.
Thank you. We're on the amendment. Further discussion on the amendment. Further discussion on the amendment. Seeing none, all in favor of the amendment, raise your hand, please. Amendment is passed. We're back on the bill. Senator Boner, did you have some testimony?
Sure. Just mostly a question, I guess, maybe for the folks on the committee that were there for the interim, and it deals with the membership of this task force. And I noticed that there's only one representative from the business community, and just a little bit more discussion. It seems like this is heavily weighted towards government officials. I'm not saying that's necessarily wrong, but there's a huge impact on the private sector as a result of these health orders. And I think part of the I can guarantee you part of the discussion moving forward is and just your difference of perspective depending on whether your livelihood was significantly affected as a result of the health orders. And so just a little bit more discussion as to why we only have one member of the business community. You talk about diversity amongst the counties. That's a very good point. But there's even, I'd argue, a greater amount of diversity in our business community between large corporations or small mom and pop shops. And so just a little bit more discussion as to that. And I certainly agree with my colleague from Cheyenne about we don't want the task force to get too large because at some point it becomes unwieldy. And I'll also point out, I'm looking at the 6 members of the legislature that could help, if we want to reduce the numbers in the task force. There's a significant opportunity there with the way the bill is drafted as well. So just a little bit more discussion about why we only have one member of the business community on the task force.
Thank you, Senator Boner. Senator Nethercott.
Thank you, Mr. Chairman. So one, I think it's important to note that public participation, I think, with the task force will still exist. And so just because maybe they're not a member of the task force doesn't mean that they cannot be heard as a result of the task force creation or membership. So certainly hearing from the business community when those meetings take place will be important. But that said, in reflecting the concerns of the good senator from Converse County, remember there are 6 representatives from the legislature who represent those businesses and those communities. There's now going to be 2 county commissioners or members of those county associations. So that's 8 elected officials representing those businesses throughout our state, adding 2 private medical providers who are also business people too, right? I mean, they reflect that participation. I know as a lawyer, I never get identified as a business, but I assure you, doctors are in business for earning a living as well as providing care. And then the actual representative from the business community. So you'll have 9 representatives, I think, as elected officials and private industry who 9, arguably 11, reflect those concerns. So as in an effort to really rein in the costs associated with the task force and the size of the task force, I think that's the reason why. And the committee, we heard lots of testimony and support for the effort, and it became somewhat concerning for how much participation was desired. And so I think at the time we wanted to just kind of be pretty cautious before we had too many hands raised who wanted to volunteer.
Senator Boner.
Yeah, thanks. Appreciate that. And it wouldn't just, the question is purely information. I wouldn't even characterize it as a concern with the bill. And the second one is along similar lines with the appropriation. I didn't see any discussion in the bill as to the frequency with which this task force was to meet, but it seems like the constraining factor would be the appropriation. So any information as to roughly what the expectation was for the frequency of the meetings before they produce that final product, that'd be helpful for me as well.
Mr. Chairman? Sure, Mr. Chairman, and Senator Scott, in case whenever you're ready to participate, that'd be helpful. You know, I don't know that we discussed the frequency of the meetings, but I do think, Senator Boner, you're correct that the costs associated with the constraints tells us how often the committee can meet. Of course, if they meet remote, and there's no per diem, those meetings can occur much more frequently. So I think it depends on what the task force decides, how it wants to meet and where it wants to meet. And of course, the size of the committee, it continues to grow. Right now, we've had a request for 2 more positions, one from the commissioners, and then the governor's office wants its own particular representative as well, with Warren's discussion. So fellow chairman, how much does it go, all 5 of us? How much does it cost to run a meeting for one meeting located, you know, outside, and then divide that, I think, by the 60. So I think we can meet a few times, and that depends on number of membership and remote or not remote and how that chooses to proceed.
Senator Boner.
Yeah, I guess the point is hopefully we might want to start being intentional as to the frequency of the meeting, not have it be dictated by the number of members or other factors that may not be under our control once we get the ball rolling. So just food for thought there.
Further comments, committee. Senator Scott.
As I count it, we've got 13 members now. You're with the appropriation that's there, you've probably got enough for, it's very close to the size of an joint interim committee. You're going to have a few people that are permanent government employees, and that will save some money there. You're probably looking at enough for 3 or 4 meetings, and probably before this goes to appropriations, we ought to ask LSO to cost it out and tell them, I would tell them enough for 4 meetings and or 3 meetings and a couple of I hate these Zoom conference calls, but that might be a good way to have an additional interim meeting or 2. I think you'll have a lot of people coming and wanting to give testimony. So you're probably talking about 2-day meetings.
Further testimony, committee. Senator Nethercott.
Thank you, Mr. Chairman. At the request of the governor's office, you know, for the committee's consideration and purposes of our discussion, do we want to have someone specifically appointed to the task force that is a representative of the governor's office?
I'll enter in a little bit. I was about to go. Before we get to there, I'll mirror Senator Scott's statements. I hate these task forces with a passion. I think this is a critical one. It's one that absolutely has to happen. This was a major event on the state's budget and the state's people, and it's one that goes far beyond an internal review or an after action report. This really is one that we need to learn some lessons on what we did right and what we did wrong and how we can refine in the future. And I think this is a critical one. Back to a member from the governor's office, unless they want to fund it, I'm not very keen on it. My belief is they're going to be at the meetings, regardless of whether they're on it or not. And they've got their way of doing it. I'm happy if that's what the committee chooses, but I don't see it as overly necessary. They'll be doing their own reviews as well. But I think this committee is kind of a beast of the legislature, and I'm sure their governors can have ample means and methods to influence this committee in any way they'd like. With that, received for further comments. Do we have a motion to do anything, or are we? Okay, we're back on the bill. Any further testimony on the bill? Question being called. Roll call on Senate File 30, Pandemic Task Force Review. She's moving. Are we able to do a roll call vote? Not sure. Looks like at the committee room we don't have staff.
So, Mr. Chairman.
Mr. Chairman, I can do it for Judy if she's having issues. There you go.
Perfect.
Great. That's how I was to suggest, because we can do it. Thank you.
I'm sorry, can you hear me now?
There she's back. She's back now, so
Okay.
hopefully we're ready.
I'm not sure what happened. Senator Boner,
Aye.
Senator Case,
Aye.
Senator Nethercott,
Aye.
Senator Scott,
Aye.
Chairman Driscoll.
Aye.
Okay, Senate File 30 passes as amended.
Very good. Thank you. We are on to
Mr. Chairman.
Senator Scott.
Mr. Chairman, I would urge you to ask LSO in preparation for going to the Appropriations Committee to cost out what various levels of meetings actually would cost so that we can be intelligent in front of the Appropriations Committee.
Consider it done, Senator Scott. They're on, and that's formal request. So Judy can take care of that, but we'll make sure it gets done. Thank you. We're now on to Senate File 76 on broadband. And once again, as normal, where I wasn't in the interim, I need to know who to have present.
Mr. Chairman, I think this is Representative Sommers' bill and Senator Dockstetter.
Senator Summers is on with his hand up. We'll put him in the room, and I knew Dockstader was on it, but Representative Summers, you're on. Are you ready to testify or to present the bill for us?
Poor man has a cow coming out of his ear.
Not anymore. We've fixed it.
Mr. Chairman, thank
Senator
you.
Summers, are you prepared to bring the amendments as well, Representative Summers?
Mr. Chairman, I'll talk about some of the amendments, and I think industry will kind of fill you in on the rest of the amendments. Can you hear me okay?
Yes, sir, we can. Thank you. Please proceed.
All right. Thank you, Mr. Chairman, fellow committee members. Last spring, Management Council created the Broadband Task Force. And the idea with that task force was in an attempt to try to improve broadband around the state and to do things quickly. Some of that we got done in conjunction with the governor's office through the Connect Wyoming program with the CARES dollars. We looked at other bills. Some bills have already come through House court. Well, in fact, one bill went through both bodies in corporations. It was a corporations bill. And what this bill is trying to do is update the broadband grant program that we have in Wyoming that was created out of the endow money. So we had $10 million set aside. And to date, not one dime of that $10 million has been spent. And so in discussions with industry, we decided to take a look at the statutes and see where perhaps we had written statutes too strictly or what we could do to improve it. And so the result of that is Senate File 76. And so, Mr. Chairman, I think probably the easiest thing, and I'd sent you guys my notes, so I didn't see any point in going through them, and you've been on a busy schedule. So if, with your permission, Mr. Chairman, I'll just kind of walk you through the bill and kind of explain as I go why we did what we did in these changes.
Very appropriate, Representative. Thank you. Please proceed.
So, Mr. Chairman, if you go to page 2 of the bill, you can see that we create an entirely new section 912.15.10. And so one issue we heard from industry that they thought there was a need in Wyoming, and really what the old bill didn't satisfy, or the old grant program didn't satisfy, was really a middle mile piece. And so you have middle mile and last mile. The original statutes focused on last mile, but if you don't have middle mile, you can't get to the last mile. And so the idea was, well, maybe let's expand it out so we can look at middle mile. And then if you move through that section there, you'll see, you know, subsection A, the council may fund middle mile. And then that last sentence on line 9 and 10, the council shall not fund middle mile broadband projects under this article unless, and then it goes through some Romanettes. There is no middle mile infrastructure in the proposed geographic area. Romanet 2, the middle mile broadband program does not result in any overbuild. 3, the project will improve last mile. So the intent is middle mile, not just for the sake of middle mile, but to really get to improving last mile. 4, that any middle mile project, the broadband provider agrees to ensure access to that infrastructure to other providers. And then really Romanet 5, A and B is the details of how that would be done. And so big A says allow the council to participate in arbitration of determining reasonable rates in the event of unsuccessful negotiations between the funding recipient and another broadband provider for access to the infrastructure. And big B, provide to the council upon council's request any marketing information to assist the council in determining reasonable rates. And if my recollection is correct, this language was kind of brought out of YDOT, where they do a similar thing on their WyoLink towers to ensure that providers have equal access. And so that, I know that we kind of captured some of that, worked on that language with industry. Then if we turn on to page 4, and you see subsection B just allows the council to promulgate rules on this middle mile piece. And then we go into revisions of existing statutes, 912.15.01, and we change the speeds. And on the top end, we go from a gigabyte down to 900 megabits. And this is really to facilitate those kind of older, you know, they're not older, but they're more of the wireline companies, you know, and I hate to use a name, but like Charter and others that you know, provided a different service, and they can get up to around 900, but they provide a 900, 930, something like that. They don't provide quite a gigabit. So that was the idea, was to pull them, to allow them to be eligible. And then we reduced the speed to 35 megabits per second in business corridors on the upload. And the idea there was just to make sure we didn't, that 35 megabits upward, you know, upload, that's really good. I mean, even in a business corridor. So we just, based upon testimony we heard, that's where we went. And then on page 5, we go on to see a governmental entity that could be involved in one of these projects. Which is Romanet 2, a governmental entity, and those were a city and a town, and it was decided to put in an improvement and service district or county or joint powers board. And so just to kind of get a little larger swath of governmental entities. And then on big C, we added in a state agency. And the idea was perhaps a project is brought towards the business council, and the business council could then be the entity, for example, or YDOT could be the governmental entity that helps put this project in place, goes out with an RFP, gets a industry partner. The idea is not to provide government broadband through a state agency. It would still have to be in coordination with a private provider. And if you go on to page 6, it makes that clear. In this language at the top of the page was before, if a governmental entity at city or town and they went out and with an RFP and they didn't get any takers, then they could go ahead and put in broadband themselves. But that's not the case will not be the case with the state. And so when you look in that, those amendments in, like on line 4, subparagraph C, Romanet 2, A or B, but not C, and C was the state agency. So we're clearly excluding state agency from the ability to put in government broadband. And then you go down into G, and really this change on G, lines 14 through 17 is just moved into a different sector, into a different section. You'll see that come in later. The last part of this on page 6 is definitions, defines last mile. Going on to 7, it defines middle mile. Then we go into 9/12/1502, and funding under this article to a public-private partnership shall not require of the partnering business entity, Romanet 2, rates, terms, and conditions that differ from those the providers offers to other service areas, except as it relates to that middle mile that we put in, and the verbiage we had in the middle mile on how that has to be provided to other providers. So that's just the nuance in there. 9/12/1503, going on to page 8. Romanet I, the location of the project, including a shape file. That was one thing the business council, they have had some applications and they are working through a few applications. But one thing that's really been missing and would really be needed, particularly in a middle mile, is to get a good shape file. So this is going to require a shape file. And then in subsection B, this was another piece that was asked for by the business council. And when they got into getting applications, they felt that this was important and that the council may require an applicant to submit additional information to enable the council to properly assess the application for funding. The council may request an applicant to modify an application based on current broadband access in the proposed geographic broadband service area before awarding funding under this article. So they didn't really feel like they had the ability to go back and ask for a little correction without going through another submittal on another application. So that's kind of that. 9/12/1504, the challenge process. Challenge process was put in place to ensure that if an applicant was putting a project in, that they didn't overbuild existing infrastructure by another provider. And so the challenge was the ability for an existing provider to challenge that service exists. Some of that language was onerous, and so we've kind of modified that. And so really what you see in subsection A on page 8, prior to this, the applicant had to go out and notify all of the entities, even though the agency had kind of the list of entities. It was the applicant's job. So what this is going to do is switch that to the agency. And so when the agency gets an application, they would simply go out to those providers in that area and ask, do any of you want to challenge? Do any of you have resources in this area or about to have? Because that can be included. And then if you go on to page 9, we tightened up broadband service provider can do a challenge, and we had within 30 days we switched that to 10 business days, and you're going to see an amendment to go to 14 business days. And I'm certainly fine with that. I think that was reasonable. We thought the 30 days was too long. Perhaps the 10 business days is too short. And so the compromise I see was fine that's being brought. And then we go into Romanet I, and it basically, it says the provider currently provides or has begun construction. And then here's where we changed, and here's where an amendment comes in. And we changed it because of the words, and took out the words other significant steps towards construction. So really, what did that mean, and how was that defined in rulemaking? It seemed pretty waffly. So we put in this bill, has received other federal or state funding for a project in the proposed geographic broadband service area. We had a comment back kind of after we had drafted the bill from a provider, and you will see that amendment, I believe you have it, that would say has received, obtained approval for, or won an auction for, and then I believe it other federal or state funding for a project in the proposed geographic broadband service area. So just a clarification of what received actually meant. And then if you go down on the bottom of page 9, and I'll just kind of read subsection C so you understand what it's doing. If the council denies funding to an applicant as a result of a broadband service provider's challenge made under this section, and the broadband service provider does not fulfill the provider's commitment to provide broadband service in the project area. So in other words, the provider's going, no, I'm going there. I'm going to be there within a certain amount of time. You know, don't fund this project. And then he in fact doesn't follow through. Then what we want to do is change it and make it a little, I guess, a little more onerous. And that is, the challenging provider is prohibited from applying for funding for a project under this article for the following 5 years, and the council is prohibited from denying funding to an applicant as a result of a challenge by the same broadband service provider for the following 5 years. And so the idea is, if you didn't follow through on your original promise, then we want to make, I guess, a little tougher for you to challenge and a little tougher for you to receive funding, just to ensure that that doesn't happen. And then we go into 9/12/1505 funding determinations. Subsection B, the council shall give priority to applications that meet one or more of the following criteria. And then on page 11, we set up, you know, I mentioned we kind of realigned the verbiage. And so we put that, what was in a different part of statute in this, and that is that are the projects that are economically and technically feasible for expanding broadband access in unserved areas of the state. So in other words, the council shall give priority to applications that are projects that are economically and technically feasible for expanding broadband access. And then the repealers, and let me get a little sip of water or coffee. And I think I might have sent you the repealer list, but I will go through those repealers with you. And so 9/12/1503 A9 and A10 are provisions requiring applicants to provide information that within 6 weeks of applying, the applicant contacted in writing all entities listed with the Business Council as providing broadband internet access in that service area. And so what we've done, remember, is taking that burden off the applicant, put it on the Business Council to send out to broadband providers in the area. So it's not that this won't happen, it's just going to be happening by a different entity. And then 9/12/1506 limitations, and prior we had this subsection A, and I'm just going to read it. No agreement under this article may fund more than 50% of the total cost of a project, At least 10% of the project cost shall be matched in total by the governmental entity or governmental entities submitting the application. The council may reduce the minimum local government match based upon the merits of the project. Grant funds from other state or federal grant programs may be used to meet the 50% minimum matching requirement, but shall not be used to provide the minimum match required of governmental entities. So basically we thought, you know, we haven't got money on the ground. So let's open this up a little more and see if we can get these projects going. And industry seemed to support that. And so we basically took out matching requirements. And let's see, 1508, we got rid of the minimum broadband speeds rulemaking. And this was, the council shall establish by rule minimum business and residential upload and download speeds which broadband projects must meet upon completion of construction to qualify for funding under this article. In establishing minimum speeds, the council shall consider speeds, and it kind of goes through this. Well, it was already in statute, and it's in, we just amended it, if you'll remember, in a section above. And so it was really duplicative. And so we just felt that we would get rid of this piece of the statute because really the other one governed it. And so, Mr. Chairman, with that, I've kind of went through the two amendments that I kind of know of. I know there's another one by industry, but I'll let them speak to it. And I would stand for questions, Mr. Chairman.
Thank you, Representative Summers, co-chairman of the Broadband Task Force. Questions for Representative Summers? Looks like you did a great job, or no questions. Oh, we have one. Senator Scott. Barely can see your top of your head, Senator Scott. There we go.
Mr. Chairman, my question, and just make sure I understand what's going on here, because I'm not that familiar with this area. Am I right in thinking the concept is to subsidize the providing of broadband services to areas where we think that the private sector won't have enough a market to do it entirely on their own and it won't get done? Is that the basic concept of the bill?
Mr. Chairman, it is. That was the basic concept of the original bill and the statutes that are in place. What we're doing here is modifying those statutes that were created in 2018 and trying to make it a more usable program. There are a lot of federal dollars subsidizing in this space as well, but we know there's holes in Wyoming, and the idea was, can we try to target some state dollars to holes that we know of and try to just improve broadband, Mr. Chairman.
Mr. Chairman, follow up.
Go ahead, Senator Scott.
Mr. Chairman, and the testimony right that there was, we had appropriated $10 million as part of the Endow effort. And am I right in thinking that that's general fund money?
Mr. Chairman, let me dig. I happen to have that bill here, and I'm trying to remember if that was LISRA money or my mind tells me it was LISRA money.
Okay. Well,
but I will look at the back of the bill. The provision. Yeah, it was, Mr. Chairman, it was LISRA money.
okay, Mr. Chairman, and the LISRA general fund doesn't make any difference. It is money that we have flexibility with.
That's correct, Mr. Chairman.
Thank you. Further questions for Representative Summers? Thank you. I believe we've got people in the waiting room. Looks like Jody Levine's in. Welcome, Jody. Are you available?
I am, Mr. Chairman. Thank you. So it's a little bit of a delay when you get brought in, but thank you. Good morning, members of the committee and Representative Summers. My name is Jody Levin. I'm here today on behalf of Charter Communications. Charter was an active participant over the interim with the Broadband Task Force. Several of the amendments that are in the bill are a direct response to some of the concerns that Charter had with existing law. Specific to this, and I want to extend appreciation to the task force for addressing this concern, is the language on page 4 in subsection B. This is the speed definition for a business corridor to address how Charter provides its gig level service. So it is 900 over 35. That without that language, the concern was that at a gig, Charter's entire service territory could be overbuilt for business corridors. And by all accounts, 935 is a served community. So that was a real technical definition, but we appreciate the task force addressing that. A number of the changes in the bill are issues that Charter does support. We believe that these are important modifications to statute to make this a more workable program. There is one, I apologize, there are 2 issues. One of the, I actually emailed both of these to you over the weekend. The first one is on page 8, and this is within the application process. So the way this program works, a provider finds itself in one of 2 scenarios. Either you are the applicant, or you could potentially be the entity that is needing to file a challenge to an application because you serve an area. So one of the amendments that I emailed over the weekend was an effort to kind of strike a balance between information that you may be providing in an application that you believe is sensitive information, confidential, proprietary, and then also needing to ensure that an application has sufficient information so other providers are able to determine whether a challenge is warranted. The amendment that I sent you is a reflection of a compromise between industry. Charter was comfortable with the notion that we could just ask the Business Council to do a rulemaking on this. Other providers and other interested parties in this debate really felt like we needed to specify some elements that would need to be made public. I don't know if you have that amendment in front of you. I've also filed it with LSO. I'm happy to read through it. But in essence, what we're asking is that by September 1st, that the Business Council, after opportunity for public comment, adopt rules. They undertake a rulemaking to address this issue of what information should be confidential. The core issue under current law where my client has a concern is the idea that you must file a business plan as part of your application. So within that business plan, you may have information that dictates your future deployment of service. And because this is a competitive industry, that's something that my client feels isn't necessary to be made public. It isn't necessary for a challenging provider to be aware of your future deployment plans, and they would like that information to remain confidential. To address some of the concerns of the other industry providers, they specifically asked that the following elements be made public. So any information that is, of course, publicly available, the name of the broadband grant applicant and the amount of funding sought in the application, information which is to be publicly posted, provided to other carriers or to a legislative committee pursuant to Wyoming Statute 912-1504A or 912-1507. That's all part of this article. The recipient of and the amount of the broadband award grant, information supplied by the provider with the consent to actually release it as public information. And then, of course, any information that the Business Council deems be made public after a hearing on the issue. So that is the overriding issue with that amendment. The other issue that Representative Summers already addressed is on page 9. This was also included in the amendment that I emailed over the weekend, and that is a request to take the challenge process deadline from 10 business days to 14 business days. There are pretty punitive elements of this bill if you are a challenging provider and you don't provide service. So we want to make sure that industry has sufficient time to go and do the research, determine whether or not they have service in an area, and determine whether or not they're going to file a challenge. 10 business days really felt short to not only my client, but I think you'll hear this issue from other providers as well. So the compromise that we asked for was to give us a couple more days and extend that to 14 business days. Those are the two issues, Mr. Chairman, and I would ask for the committee's favorable consideration and stand for any questions.
Questions for Ms. Levin? My apologies for addressing you by your personal name to start with. I realized after I did it, that's my bad.
It's okay, Mr. Chairman.
Any questions for Ms. Levin? Okay, Ms. Zerga, would you like to welcome?
Thank you, Mr. Chairman. Good to see everyone. Liz Zerga on behalf of the Wyoming Telecommunications Association. The association was very active over the summer and interim with the Broadband Legislative Task Force. As you all know, broadband was a priority for Management Council and the Broadband Legislative Task Force. And the question that was put forth in the proceedings, as we went from some very large bills down into bills broken down into smaller portions, was what can be done to improve upon the program that is already set forth in the state statute. And that was a discussion that was had over multiple meetings, and Senate File 76 is the product of those meetings. And the association provided input, as Ms. Levin indicated. Cable requested that the speeds that they provide be considered and recognized as adequate for broadband for purposes of this program. The association, my association, was in agreement with that ought to be recognized. Another important part to making the program more accessible was local governments told us that the match requirement was an impediment. And so we agreed with the removal of that match requirement. One of the big issues was middle mile. And in parts of this state where there is not adequate access to broadband speeds, there is simply a lack of middle mile. And as Representative Summers, Majority Floor Leader Summers indicated, you have to put certain things first before you can get broadband there, and middle mile is one of those pieces that in at least certain parts of the state is sorely lacking. So that was added to this bill, and that is something that we were very supportive of. So in summary, we worked with all of the providers, we worked with Chairman Summers, and we worked with the task force, and we support Senate File 76. We also are supportive of the amendment that Chairman Summers indicated he was bringing with respect to identifying who can challenge the bill. We are supportive and in agreement with Cable's recommendation that you accept the amendment that extends the bill's current challenge deadline of 10 business days to 14 business days. And I worked with Ms. Levin on the confidentiality piece. As Ms. Levin indicated, cable felt that certain things should be kept confidential in the applications. My clients perhaps have a view that things should be public with public money. And so we put in some of those elements to make sure, and where we have any remaining dispute over what should be public or what should be private, we'll take that to a rulemaking. And that's what the amendment provides. And we support that amendment. So I think that covers the bases. And if you have any additional questions of me, I'd be happy to try to answer them today.
Questions from Ms. Zerga. Senator Scott.
Mr. Chairman, she mentioned the removal of a match requirement, and I think I recall that from Representative Summers' presentation as well. Am I right in thinking that's just for local government, and is there a match requirement for others? And I presume it's in the repealers, is that correct?
Mr. Chairman.
Ms. Zerga.
Senator Scott, the way the original law, the current law is drafted, is the grant could fund up to 50% of a project, and there was a requirement of a 10% match by a local government. And the repealer repeals that section.
Further questions from Ms. Zerga? Thank you.
Thank you.
Mr. Gopian.
Thank you, Mr. Chairman. Can you hear me okay?
Yes, sir, we can.
Certainly. Thank you, committee. Nick Agopian. I represent Visionary Broadband. For those of you that aren't familiar with Visionary, Visionary is a Gillette-based, Wyoming-based internet service provider. And they operate across Wyoming, Montana, Colorado in the region. And they are, I believe that the committee saw the CEO, Brian Worthen, on the floor last year. It's been a long time since everybody was on the floor, and certainly thanked both the House and the Senate for recognizing the CEO and his accomplishments with the creation and with the growth of Visionary. Today, my comments are me too. I reached out to all of you individually to make sure you are aware. Visionary Broadband supports Senate File 76 and supports the amendments before the committee, or that we expect to see before the committee today. The investment by the state in broadband just in 2020 was significant and has shown significant success, certainly for Visionary and a lot of the other providers that you're familiar with here in the state. With that, I want to keep the ball rolling. We're closing in on noon. And unless there's any question, I would stand for questions, Mr. Chairman.
Questions from Mr. Gopian? Seeing none. Thank you very much, Mr. Gopian. Do we have anyone else in the waiting room wanting in? We do have Kelly Little. I see he has got a hand up. Welcome, Miss Little.
Good morning, Mr. Chairman, members of the committee. My name is Kelly Little. I'm with the Wyoming County Commissioners Association. The WCCA has taken a position of support on this bill. We commend the work of the Broadband Task Force and the continued commitment of the state to provide access to broadband in underserved communities. We also appreciate the elimination of the local government entity match, which will allow flexibility and opportunity to communities and providers to expand broadband access in a way that is appropriate for each particular project. We would ask for the committee's favorable consideration, and I would stand for any questions.
Questions for Ms. Little? Thank you very much.
Thank you, Mr. Chairman.
Okay, looks like we've got a few in the waiting room. I see no hands. Anybody in the waiting room to come in? We do have Charlene Murdoch. Miss Murdoch, she'll be up in a second, I believe. Welcome, Miss Murdoch. We've got you. Welcome.
All right, thank you. I will keep it very quick. Charlene Murdoch, on behalf of the Wyoming Business and Industry Federation. We are a coalition of 11 chambers of commerce covering every corner of the state and many communities in between. Our membership involves people who work from home, especially during this time, but also are expanding their businesses and need this connectivity. So I'm certainly leaving the technical aspects of the bill to the experts who have participated on it, but really just wanted to weigh in and say this is really an important bill for expanding broadband across our state, and we're very supportive.
Thank you. Questions for Ms. Murdoch? Seeing none. Thank you.
Thank you, Mr. Chairman.
We have 4 left in the waiting room. If they'll raise their hands, if anyone would like to testify. Don't see anybody raising their hands. With that, we will close public testimony. Committee, what is your pleasure?
Bill.
Okay, the bill is moved. Discussion on the bill and amendments. I know we have some amendments. Someone want to move amendments?
Mr. Chairman, I would move the amendment as presented by Ms. Levin and discussed by Representative Sommers as well.
Okay. Committee, do we have discussion on the amendments, or do we understand them well enough to go for the amendment? Excuse me.
Mr. Chairman, for purposes of clarity, I'll read what that amendment would do. On page 8, after line 13, insert a new subsection C to 912-1503. And it will read as follows. Except as provided below, the Wyoming Business Council shall identify, pursuant to rules adopted on or before September 1st, 2021, after opportunity for public comment, the nature and type of information provided by broadband providers to the council that will be treated as confidential, trade secret, or proprietary, and protected from disclosure to the public. Notwithstanding the foregoing, the following information is not confidential, trade secret, or proprietary, and shall be disclosed. Romanet 1, publicly available information. Romanet 2, the name of a broadband grant applicant and the amount of funding sought in their application. Romanet 3, information which is to be publicly posted, provided to other carriers or to a legislative committee pursuant to Wyoming Statute 912-1504, subsection A, 912-1507, or any other provision in the article. Romanet 4, the recipient of and the amount of any broadband grant award. Romanet 5, information supplied by a broadband provider with consent from the provider to treat the supplied information as public information. And Romanet 6, information deemed public information by the Wyoming Business Council after a hearing on that issue. So, Mr. Chairman, I believe that proposal and this amendment strikes the right balance between protecting the rights of business entities and their proprietary information that should remain confidential versus that information which should be public and allows for the public to evaluate those decisions through the Business Council appropriately. The second part of the amendment is on page 9, line 4, to strike 10 and insert that 14, as we heard lots of discussion about, which I don't think there's much controversy with, allowing for a longer time to respond. And so with that, Mr. Chairman, that's my amendment.
Well presented. Thank you. Questions on the amendment, committee? Questions on the amendment? Question being called. Everybody in favor of the amendment, raise your hand, please. Amendment is passed. We're back on the bill. Do we have another amendment? I was thinking there was one more out there, but I don't have it in front of me.
Mr. Chairman.
Representative Sommers.
Mr. Chairman, I could go over the amendment and then if you all want to move it, you can or whatever. But so if you go to page 9, line 11, after received, it would insert obtained approval for or won an auction for. So the sentence would read, the provider currently provides or has begun construction, has undertaken permitting, or has received, obtained approval for, or won an auction for other federal or state funding for a project in the proposed geographic broadband service area. And that was just an attempt to clarify what received meant, just to make sure we had everything.
Very good. Questions of Representative Summers? Okay, no questions. Does anyone like to move the amendment?
Chairman Driscoll, may I hear that amendment again, please?
Please. Do you have it in front of you, Senator Nethercott? I've only got one screen.
I do not have it in front of me, Mr. Chairman. Representative Summers, do you want to email that forward?
Yeah, I sure can. I did.
Did you send it?
Thought I did that the other day, but
I have it right here, Mr. Chairman, actually. So
very good. Thank you. I'm sorry. All I've got is my phone and I can't get it up.
no, you're fine. So, Mr. Chairman, on page 9, line 11, after the word received, insert obtained approval for or won an auction for.
Or
and Mr.
what's the
Chairman,
word
I could
before
explain
option?
if you'll let me. I'll give a little more explanation.
Let me just make sure our secretary, our Senate staff gets that. So let me read it one more time, and I'll read it slowly. I have to do this for my court reporters too. I go too fast. So I'll slow down. So page 9, line 11. After the word received, insert a comma, obtained, approval for, or won, WON, an auction for.
Thank you very much.
It sounds goofy when you read just that amendment. It doesn't make a whole lot of sense without seeing it in there, but that's the amendment, Mr. Chairman, and I would go ahead and make that motion.
Staff, did we get that good enough? If
Yes.
not, we'll get it to them. So,
Yes.
okay, thank you. Amendment's been moved. Discussion on the amendment. Discussion on the amendment. Question called. All in favor of the amendment, raise your hand, please. Okay, amendment is passed. We're back on the bill. Discussion on the bill.
Question on the bill.
Question being called. Roll call on Senate File 76, broadband as amended.
Senator Bonner,
Aye.
Senator Case,
No.
Senator Nethercott,
Aye.
Senator Scott, Senator Scott,
Aye.
aye, and Chairman Driscoll.
Aye.
Senate File 76 passes with 4 ayes and 1 no as amended.
Thank you.
Committee. Thank you, Mr. Chairman.
Thank you. Good job. It's 11:45 committee. The next bill does not have sponsors available to present it. So unless you want to do different committee, I think we're going to go ahead and adjourn. I will take your advice, but we've got bills done. I think we're well done. Everybody's done great work today, and I think we'll just go ahead and adjourn.
Mr. Chairman?
Senator Case.
Well, we do have 45 minutes, and there's one more bill after the elected attorney general. You said if time permits.
We can do that if you'd like.
I think it's we just get jammed up, we might as well do it. If we can't finish it, that's fine too. But
Okay.
I'm happy.
I'm open to suggestions on it. We've got a pretty good line in the pipeline as well, so we'll go ahead and move to the next one. Let me get it pulled up.
Who's the prime sponsor on that one, Senator Case?
Well, that's a good question. I hope he's available.
Yeah, that's the problem is I actually texted the sponsors of the next bill and they're not around. So we are up to air ambulance, Senate File 46, and I know there was a lot of testimony out there, and I don't see a whole lot in the room. Let's take it's 11:47. Let's take a 10-minute break, and we'll come back in if they've got people that are here to testify and present.
Well, Mr. Chairman, it's my bill. I'm here to present.
All right. Well, would you like to take a break, or you want to take off running?
I can do either. It seems like, Mr. Chairman, that we don't have much time, but I don't want to stand in front of a committee that wants to break.
Okay, Senator Case, Senate File 46, air ambulance. I was trying to make it where you had a meeting room full of people in Cheyenne, but we're going to let you do it live. Go ahead and go.
Mr. Chairman, thank you very much. This is a bill I'm bringing with my co-sponsors, Senator Salazar and Representative Larson from the Bighorn Basin. It relates to air ambulance services, which are a very important part of, kind of the Wind River Basin area and the Bighorn Basin area, in that so many of our folks have to be transported to larger urban areas when there's a medical crisis. And so you would think you're kind of in Vietnam when you hear the helicopters coming over, picking up people. But Mr. Chairman, a couple years ago, there was concerns about how air ambulance companies were marketing a membership to their to potential customers. In essence, it's a common practice for these companies to provide a membership, and what they do is they sell a subscription service, and if you need their services and you've paid your subscription services, they'll come and take you to provide the transport. But there's a lot of rubs in this. The subscription service, Mr. Chairman, is a membership only good for that company. I don't know how it is elsewhere in the state. In Fremont County, for example, we typically have 2 air ambulance companies. The legislature became concerned about this. They felt that there were definitely some people that believed they had a subscription service, or they had it, we would consider as insurance, and that when the time came for them to be transported, they were actually transported on a different company than they had a membership for. And as you can imagine, that was a terrible surprise in the bills. Also, Mr. Chairman, it has been suggested that there was sort of heavy duty enforcement or sales of these, and that there wasn't adequate disclosure to perhaps maybe elderly people that some of their Medicare would actually pay for some of these services. It's been a mess, but people are scared to death. They were very upset when the legislature eliminated companies from providing these types of memberships and said, if you want to provide air ambulance insurance, it has to be true insurance. And there is a company or two that are providing insurance through the Department of Insurance. But I have had a great number of people contact me in a big backlash that want to be able to purchase memberships within particular companies. They know what they're doing. They understand it's not insurance, and they like to be able to continue the practice. It gives them some peace of mind. This bill is an attempt to provide that and provide it in a manner that is as safe and effective and contains the disclosures. So really what it does, Mr. Chairman, if I can go through the bill, let me get the piece with the line numbers. I'm sorry, I have the. Come on, there you go. So it's an act relating to insurance requiring disclosures related to air ambulance transportation memberships and subscriptions, providing penalties for failure to provide disclosures, amending the definition of disability insurance, and providing exemption for the regulation of air ambulance transportation memberships and subscriptions as insurance. The gist of the bill, Mr. Chairman, is that we go to page 2, lines 2 through 8. We define what air ambulance transportation membership and subscription is. We require that they be provided in writing and that they contain particular information. Line 17 through 23 on page 2 says this agreement for air ambulance transportation services is not an insurance contract and is not regulated, monitored, or reviewed by the Wyoming Department of Insurance. The business practices and financial condition of the person or company offering this agreement may not be reviewed or regulated by the Department of Insurance. There's a violation on page 3, WS 261107. And you can see that we go back to the insurance code. 26, by the way, is the insurance code. And line 8, 261104 is the applicability. And it says that the insurance code does not apply to Romanet 7 persons offering air ambulance transportation memberships and subscriptions in this state, except as specifically provided in these specific sections. And so if you recall, when we worked in this area before, we defined air ambulance service as disability insurance. That was kind of a stretch, I think. So we are backing that out. Page 4, I believe it is, lines 2 and 3. That's the bill, Mr. Chairman. It's effective immediately, and I'd be happy to answer any questions. I note that my co-sponsor, Senator Salazar, is on the call as well, and I know that he would like to add some.
Questions for Senator Case? Questions for Senator Case? Thank you, Senator Case. Senator Salazar, would you like to testify on the bill, please?
Thank you, Mr. Chairman. I know time is precious, and I'll just take 60 seconds. Senator Case laid it out very clearly. I'll simply add this. I've received more phone calls from my rural district on this issue than anything else that I have seen in the legislature during my 4 years. This is so essentially important to my constituents in a rural Fremont County, particularly in the counties such as ours where ground ambulance service is at a crisis as it is. This is really, in some instances, the only way people such as citizens in Du Bois can get immediate health services if there's not a ground ambulance standing by. So with that, Mr. Chairman, I just wanted to relay that information, ask for your support, and appreciate what the committee is doing by hearing the bill. Thank you.
Questions for Senator Salazar? Thank you. Good job. We have Mr. Kilman Burnham in the waiting room. Are you ready?
Yes, sir. Can you hear me?
I hope I didn't butcher your name. We can hear you. Welcome.
No, you did it absolutely fine. Thank you very much, sir. And I apologize. My voice is a little scratchy, but I've got a really bad and sort of cold thing going on here. But I'm Mark Kilman Burnham. I'm from Global Medical Response, and we're the parent company of what's called AirMed Care Network. And we're one of the providers that were sort of unable to move forward with selling our memberships when the House Bill 194 passed. And as I read this and look through this this bill, and I was trying to clarify, because we're also working on a House Bill 7 that sort of relates to this. But what I like about this bill is that basically, as I understand it, and the The senators and representatives will have to correct me if I'm wrong, but it basically takes us back to where we were before. And it looks to remove the issues that caused the problems that we had with providing an air membership. When people said to us, well, why don't you just become an insurance company? That's like telling a doctor, why don't you become a exterminator and just do it? Well, we don't have any qualifications of doing insurance. That's not what we do. We provide air ambulance memberships. We are a EMS company that provides ambulance services across the state. And like Representative Salazar said, we are one of the 3 ground ambulance companies that are really struggling to keep things going in Wyoming. So we are dedicated and committed to keeping our longstanding tradition of providing care for people in Wyoming. And we want to continue to do that. And if this bill helps us do that, that's what we're here to stand by and support. And we really appreciate the sponsors of this. I was born in Natrona County, raised in Carbon County. I've had several family members in the Torrington and the Du Bois area that have actually used our service through a membership. And I know that I've got, as the senator and the representative say, I've gotten phone calls from family members wanting to disown me because my company won't provide them service anymore. So, we're very aware of the issue at hand. And on the call with us, one of our membership directors, our main person, Jason Monday's here. So if you have any questions about memberships and how it works, he's here to also provide testimony if you have any questions. But I just wanted to come forward and just provide my support, and thank you very much for your time.
Very good. Thank you. Questions for Mr. Kilman Burnham? Questions? Thank you. Senator Nethercott.
Thank you, Mr. Chairman. Thank you, Mr. Kilman Burnham. So my understanding that there's a number of air ambulance service providers in the state. Some of them, I don't think the request was that you become an insurance carrier. I think the request was that you work with the Department of Insurance to ensure that the memberships you're selling actually do what they're intended to do, which is to ensure that when a Wyoming citizen that is a member that paid for that service, that they actually get the service for which they paid in a time of crisis and emergency, recognizing that if one needs an air ambulance, that cost can be exorbitant. And so the concern, I think, that I've heard throughout the years is a result of maybe misunderstanding from consumers about what that membership truly means, and if an ambulance will actually be available, and what the coverage provides. So how is it that some air ambulance service providers can perform in that level of compliance, but your company has not, I guess?
Well, so here's the difference is that AirMed Care Network, we provide service with all of our own air ambulances. So they're owned and operated by us. So Guardian, Flight, Reach, those types of things are all owned and operated by us. Where these other companies will then reach out to us and say, well, can you provide this? Or though they brokerage out. So they're a brokerage and not. So one of the groups that's providing memberships doesn't own or operate any of their own ambulances. And so they broker it out, if that makes sense. They look for someone to take the call. Where for us, we provide the service ourselves. So when we sign them up on a membership, we let them know, this is your membership, this is how it works, this is your locations and things like that. And if I've made any mistakes with that, like I said, Jason Monday is on and he can raise his hand and he can clarify more if that's okay with the committee.
Senator Nethercott, follow up.
Mr. Chairman, I see the Department of Insurance is here, Mr. Root, who might be able to provide further insight into that concern or that allegation regarding the insurance piece. I think this conversation is really important. One, having a long affinity for Fremont County, I recognize the need for access to care on an emergency basis, and the importance of those air ambulances. And I'm very much aware that the people in our rural communities don't have a lot of choices and would like those types of protections, understanding it can financially wreck them and or kill them as a result of not having air ambulance service available to them. So the issue is fundamentally important. I don't deny that. I want to make sure that we do it right. I just want to make sure that all of our consumers are protected and we're getting these services to them in a way that they expect, in a way that for which they have paid. So I think Mr. Rood can provide some additional information. I think he'll be helpful to the conversation.
Thank you. Further questions for Mr. Kilman-Burnham before we go to Mr. Rood? Okay, thank you. Mr. Rood, Commissioner Rood, would you like to testify?
Thank you, Mr. Chairman, committee members. I agree with the previous speaker in the sense that the requirement is they meet the requirements of an insurance company. They not become an insurance company, but by definition, they now have to meet those restrictions we place on them, and they have to submit documents, and they have to financial documents and be subject to examination. But with that comes the consumer protection aspect of it, which is also a protection that we would provide, which under the current bill would remove that. So under this bill, what would end up happening is all of those difficult requirements. And I admit they're difficult. They are. We've only had one company apply and be licensed. But the only consumer protection under this current bill is the disclaimer, and that would be it. And if that's where the legislature wants us to go with this, so be it. I mean, we're neutral on this bill as we are with this bill or on House Bill 7. We know House Bill 7 coming up kind of mimics the Nebraska, not licensing procedure, but registration procedure. It's much less arduous. It's more akin to what we do with service contract providers, for example. They register with us. We look at a financial document to ensure they're around when they sell a lifetime membership, that they're going to be around for a while to make good on that promise. We were able to provide other consumer protections, if you will, under that bill. Currently, though, like I said, there's only been one company. Nobody else has made inquiries on this to really seriously look into becoming licensed as a disability insurer requirement.
Thank you. Questions for Mr. Rood? Senator Nethercott.
Thank you, Mr. Chairman. Mr. Rood, I want to make sure we really do this right. And so the concerns of the Department of Insurance are that these companies are able to, like any other insurance, even though you're not asking to be an insurance company, but that these carriers are able to fulfill the promises that they have made to their consumers. Is that a fair assessment? And so by doing that, want to make sure that they meet, similar to an insurance company, requirements ensuring that they can pay out or deliver when a claim is made. Is that fair?
Mr. Chairman, Senator Nethercott, it's fair. I don't think, in all honesty, they have to meet all of the requirements of a disability carrier to meet that burden. I think what we do with other entities is having an audited financial statement or an annual financial statement, for example, signed off by a member of the board of this whatever company we're dealing with, showing the finances. That would suffice. What I think is a greater role for our department in this is the consumer protections. I mean, I understand all of the senators, especially those with their names on that letter that went out, because my department was on that letter too, and I answered 250 calls, and another individual in our office answered more. And what we came to learn was there were complaints about these memberships, about what coverage do you really have? Well, I mean, these companies were prohibited in the state of North Dakota, for example. And one of the concerns was you have an air ambulance entity, a company that would only fly in the western portion of the state, but they would sell memberships along the Red River corridor of Grand Forks and Fargo. And so they prohibited them. Well, Nebraska took the intermediate approach, which the opposing bill is in the House, which lays out the consumer protections where you'd have to disclose that to people, or to at least disclose it to the department, so we know that, and we can look at the advertisements to make sure they're accurate. We can see that if they're, in Evanston and there's targeted advertisements to a retirement community, that company is actually going to be selling in that community and providing services in that community, not just on the eastern portion of the state. And so that's where I think a great deal of our concern is in consumer protection.
Follow up, Mr. Chairman?
Yes, go ahead.
Thank you, Mr. Chairman. Thank you, Mr. Rood. Any conversations with the Attorney General's Office Consumer Protection Division on this topic, on this bill? I'm really curious to hear from them as well.
Mr. Chairman, Senator Nethercott, not about the bill. I've been in talks with them against actions against their ambulance companies that are underway that I really can't discuss in this forum.
Thank you, Mr. Rood.
Senator Scott.
Mr. Chairman, question for Mr. Rood. Am I right in thinking that it's market conduct where some of the consumer protections fit in here, that you do review market conduct for companies that are selling products like this in insurance under the statute the way it's written right now? And my question, Mr. Chairman, is that the vehicle where you reach some of these consumer protections? And second, Mr. Chairman, I got a whole bunch of these calls too. And one of the things that I found that one of the first questions I needed to ask was the person that called me on Medicare. Because what I discovered, Mr. Chairman, is that Medicare covers this service. And my understanding is forbids balance billing on it. So that if you're on Medicare, the Medicare people can regulate the rates here. The rest of us can't, but the federal government reserved its ability to regulate the rates. And if you're on Medicare and use one of these services, they cover it. The testimony, the information I heard was that they sometimes gave you trouble, but they always did cover it in the end, even if they were a little bureaucratic on the way. And that these policies did a Medicare recipient no good because there was no ability to ever get a payout from them. And I'm trying to find out is what the experience of the insurance department was, how many, what percent of the people, to your knowledge, had the Medicare coverage, and is it true that they really did not need this other coverage?
Mr. Rood.
Mr. Chairman, Senator Scott, two questions there. I want to be sure I get to them both. The first was market conduct. You are correct, Senator Scott. One of the functions we conduct is market conduct. We will look at the contracts to make sure they comply with Wyoming law, that they're clear and easily understood. And we're able to look at advertising if we request it currently as the law stands now. With regards to your question of Medicare, we fielded approximately 550 calls. 80% of those were from Medicare recipients. And they did not understand that this is covered by Medicare and their Medicare supplemental program. Depending upon which Medicare supplemental program you chose, you could have a rich program or one that's a little more sparse. There might be a small copay, there might be some deductible that the memberships would cover in those instances. But in the vast majority of cases, they did not understand that this was in fact covered by Medicare with the Medicare supplement. And you are also true, you're absolutely correct, Senator Scott, that there is no balance billing under Medicare. Medicare folks, we talked with the regional rep in Denver. They said we find out that, they would really want us to report it because they would want to do an investigation.
Mr. Chairman.
Senator Case.
Mr. Chairman, I think there'll be a witness that'll present an amendment with regards to a Medicare-related disclosure. I think that's a good thing for us to consider. Mr. Chairman, I don't know if you want to get to Mr. Monday, but I'd be happy to wrap this up at the appropriate time.
Senator Scott.
Mr. Chairman, one further question for Commissioner Rude. To what extent where people have insurance through other carriers in this state, is air ambulance covered in network in Wyoming? So you're talking about the non-Medicare people that and non-Medicaid that have other insurance. To what extent are air ambulance providers in the state in network?
Mr. Chairman, Senator Scott, I know that I'll refer to them as our biggest in-state carrier, a block from my office. They have an air ambulance group in network. But I also know there's 8 or 9 that service the state. And I don't know I don't believe all of those 8 or 9 are in their network, but I believe a group of them are. As far as the others, I think the state plan was looking into it and making an option available. But other than that, I really can't say.
Thank you. Further questions for Mr. Rude? Thank you, Mr. Rude. We'll go to Mr. Monday. Welcome.
Chairman, thank you very much. Senators, appreciate the opportunity to provide some details regarding our membership program. My name is Jason Monday. I'm a divisional director for Air Medcare Network. I work on behalf of all of our national programs. So I've been out to pretty much every footprint south there to include Wyoming, and appreciated the hospitality I've received there. A couple things I'd like to discuss first, just so you have some insight, is Air Medcare Network's the largest membership program across the nation, and we've worked for 36 years to get it to where it is today. So we serve as an alliance to bring multiple air ambulance companies together under an umbrella to provide a financial benefit to our members. That umbrella are companies that all flow up through the global medical response. So as Mr. Kilman Burnham had pointed out, these are companies that we own, operate, or lease the activities of. Therefore, we have no third-party payouts. We're not paying out for any providers to provide this service on behalf of our members. That's an internal financial transaction within our own company itself. Another thing is there's no guarantee of the service, because you're working in a very time-sensitive environment with the industry of being a first responder, EMS, transport service provider. So we're not offering any guarantee and saying that we're going to cover all those other providers, because we don't do any reciprocity under our membership plan. And this is clearly stated in all of our terms and conditions that are across all the lower 48, Alaska, and Hawaii. So it specifically states it must be a participating AMCM provider. We keep our website up to date with any changes as frequent as they happen. It's very easy to see for any of our members to look on the brochure and see those terms and conditions, understand that it's only our assets alone. Our website provides a valuable service because our potential members or customers can actually go on there and plan some travel routes. And I've met with literally hundreds of thousands of residents throughout the footprint that we service that utilize this type of tool. They'll tell you that they don't live and operate in a bubble 24/7, 365. So we may not be the first provider where they reside, but where they may frequent or travel to a summer home or a vacation home, so on and so forth, they could really get deep into our network. So some of these that you may see that you may question, why are they getting the service? It's not because we're soliciting them in some of these areas where we may not be the first or second or even third caller. We're not restricting that consumer from making a choice to provide their own level of financial protection that they see fit based on their needs as a traveler. The next thing I would like to provide some clarity on is the Medicare coverage. We don't go out and seek out Medicare. beneficiaries at all. You know, we may cross paths with them in our day-to-day activities, speaking with groups, clubs, civic organizations, things like that, where we're invited to come in and speak as guest speakers. What we see on the transactional end of things, when all the dust settles on the billing side, because again, we are a service provider, which makes us differentiate from those others that serve as a third party that don't own, operate their own assets. They are quote unquote serving as more of an insurance model because, you know, they're guaranteeing something and they're assuming that risk and transfer of that. With the Medicare patients, if you read the Medicare A specifications, you'll see that that's a hospital coverage. So if that person only has Medicare A, it provides no details on any coverage for any type of ambulance transport services. So therefore, the exposure could be full on that particular resident/patient. With Medicare B, if they do not have any of the supplemental coverages, they're still looking at some of the copays associated with that 20% cost factor. Our members tell us that most of them are living on a set income at that point in their life, and a 20% copay tied to a transport like this could disrupt their financial well-being. So they choose to invest in the membership. And if you look at the membership fee for a senior household, it's $65 a year. If you look at the potential copay on somebody that has a Medicare B with no supplement at 20%, it could be $1,300, $1,400 estimated. The time that they invest in that $65 a year to equate to that $1,200 to $1,300 could actually be a very good value to them. Currently, there's other scenarios where there's disclaimers under the Medicare coverage where it talks about location or delivery location, and Medicare may approve the transport for a reimbursement period from A to B. If that patient goes from B to C through their choice or their preference, the Medicare coverage could stop at that point. So there are some exposures there that we truly try to clearly be transparent about being a service provider and share that with the potential members. Our goal is to take that member out of this financial transaction between a service provider and an insurance carrier and provide them a very cost-efficient means to prevent this from happening to them, because we don't want anybody stuck in the middle of that. So I wanted to provide some insight, just some details, really what the membership is, what it does. It's very specific, very clear on who it covers. It's a household plan. We have no restrictions on the number of household members under one residential roof. The other things are we have no co-insurance requirements. We have no deductibles. We don't require the members to have insurance. So that's extremely beneficial to the 72,000 estimated uninsured Wyomingites that have no insurance right now that would be fully exposed to those bills. And lastly, there's no caps on the number of flights we'll transport that member for. We don't keep a scorecard on these members. If they need to use the service over and over and over, that prepaid annual fee to provide household protection is all they're going to face on an out-of-pocket expense from us. So I would welcome any opportunity to answer any questions, provide any clarity regarding our services for you.
Questions from Mr. Monday? I have one. How do you handle insurance when you transport? You pick somebody up, you take them, they have insurance. Do you guys go ahead and bill insurance then? Or is your—
Yes, sir. We bill any and all insurances that are applicable to the claim. So, not only their health insurance, but sometimes you'll have an automobile insurance or, homeowners, any and all. And that talks about third-party responsibilities, which is another thing that's in our terms and conditions. And what the prepaid membership does is we agree to accept whatever that insurance, if there is any, pays as payment in full.
Follow up, how often do you end up in court suing insurance companies and homeowner policies to try to get money back?
I'm not one of our associate counsel, sir, so I'd have to defer that. I can, get that question to our legal team and get a response for you.
Okay. Thank you.
Yes, sir.
Further questions, committee? Further questions? Thank you.
Thank you.
We have other people waiting to testify. I don't see any hands in the room. There comes one, two. Mr. Laycock. Are you able to unmute and come on, Mr. Laycock? Welcome,
Hi,
Mr.
can you hear
Laycock.
me? It's good to see you guys. Thank you very much, committee. My name is Tom Laycock. I'm the Associate State Director for AARP Wyoming. I wanted to thank you for taking the time to kind of discuss this issue. In terms of AARP, we understand that our members tend to be good consumers of this product. Is certainly an attractive consumer to air ambulance membership companies. We really appreciate the standpoint of Senator Scott as well as Director Root in terms of understanding and pointing out that Medicare does in fact offer some coverage of air ambulance memberships, especially if you have a Part B supplement. From our standpoint, we would just like to be able to put some of those disclosures into the bill in a way that would ask that and in fact require air ambulance membership companies to let folks know before they purchase this this product that just suggests that they are potentially covered through their insurance company, including Medicare, and just suggests that they consult with their insurer before just deciding to purchase what these services are. The other disclosure that we might suggest is just one that would let folks know that just because you have a membership through Company A, you may not be picked up by Company A. You may be picked up by Company B, and at that point, you could be on the hook for the entire bill. So for us, it's a matter of just letting folks kind of know what they've got. Our members have told us that some of these, especially in-person presentations, can be pretty high pressure. And it would be great for folks to know that they have some coverage already through Medicare and consult with their insurer to find out what that is. From there, if folks still feel like this is a good product for them, and by all means have at it. We just think it's a good idea to go in with an informed knowledge of what coverage you've already got as it relates to your own insurance.
Thank you. Questions for Mr. Laycock?
I think Mr. Laycock has some actual language, Mr. Chairman.
Mr. Laycock.
Mr. Chairman, I had sent an email yesterday afternoon at 1:43 to the committee, and I was just suggesting a couple of these amendments into the bill. I'm not sure if you folks have interest in doing that or have the email available in front of you. I'm happy to resend it if you don't. Also happy to read what the amendment would say if it's something that's attractive to you as well.
Let's, Senator Case.
Mr. Chairman, can we have him read it? And yes, we do have it in our email, but maybe that would help the people that are listening.
Very good. Mr. Laycock, if you would like to read that.
Sure, Mr. Chairman, I'm happy to. The amendment regarding insurance coverage would read, and I quote, "You may already be covered for air ambulance services through your health insurance, including Medicare. Before signing this agreement, you are strongly advised to consult with your insurer to determine if you are already covered and what services are covered," end quote.
Thank you. That's the entirety of it?
That was the first one. The second one was, and this was just in terms of understanding that the helicopter or the airplane that shows up may not necessarily be one that you have coverage with. And that one would read, and I quote, "You should know that insert name may not be the company called in the event of an emergency situation, and you may be responsible for the entire bill if a different air ambulance company provides the service," end quote. And that's it.
Thank you. Questions for Mr. Laycock on proposed amendments that we'll deal with when we work the bill? Any questions? Thank you, Mr. Laycock. Kelly Little, County Commissioners, I think that may be our last. Welcome.
Thank you. Yes. Good morning again, Mr. Chairman, members of the committee. My name is Kelly Little. I'm with the Wyoming County Commissioners Association. The WCCA has taken a position of support on this bill. One thing our members would like to see is the addition in this bill of more robust consumer protections, as mentioned in previous testimony and similar to those found in House Bill 7, which my members prefer. Again, we do support this bill, and I would stand for any questions.
Questions for Ms. Little? Seeing none. Thank you, Ms. Little.
Thank you.
And we have two people left in the room. Does either like to testify before we close public testimony? Seeing none, I've got a real quick question for you, Mr. Monday, if you're still there or your associate. How many pages is your disclosure? Do you know? Is it one of your standard books that we get out of the legal departments, or is it a pretty short one pager?
We can put everything on our front and back page, 8.5 by 11. Our terms and conditions do address a lot of things that were brought up already. You know, as far as it must be one of our providers. If another provider transports you, that's between you and that provider. So we're very comfortable with those things because we're already doing that in our terms and conditions.
Thank you. Would you have a problem if we moved it into bold print near the top?
No, sir.
Okay, thank you. Further questions, if anybody, before we close public testimony? Public testimony is closed. Committee, what's your pleasure? Senator Case, move the bill.
I'd like to move the bill, Mr. Chairman. And if I could kind of summarize a little bit.
Yes, sir. You've got free reign for all of 3 minutes.
Mr. Chairman, this is really important to my constituents. And I can understand if you're from Cheyenne or Casper, you may not kind of get this, and that's okay. But my folks are fairly sophisticated. They actually buy memberships from different ambulance companies. I think by and large, they actually do understand this. I'm totally sympathetic to the people that have been burned in the past by thinking that they have purchased insurance, making clear it's not insurance. I can go to my plumber and I have a business with a lot of rooms, a hotel, and I can sign up for that plumber to service the hotel. I could pay him $100 a month so that he will always come. But if there's a water leak and I can't get a hold of him, somebody else has got to come. And I could go back to that first plumber and say, well, this is insurance. You need to cover city plumbing, not just Jones plumbing. And you can see where this goes. It really is the same thing. These guys are good at selling memberships for their own product. I think we had a kind of a knee-jerk reaction that was a bad thing. But what we really need to do is educate folks and have disclosures that make it clear that this is not insurance and that their Medicare does cover in certain instances. And let's let it move forward. I hope you'll support the bill.
Senator Scott.
Mr. Chairman, this bill is going to take quite a bit more time. We need to talk about the background that brought this on, some of the other practices in the industry. I think that needs not only the amendments that Mr. Laycock was suggesting, but several other in the consumer protection area. And I'm intrigued by the notion of doing it more like what Nebraska did it, which I think was the original intent of the legislation that did this. There's major problems here, Mr. Chairman. My question for you is, are we going to spend another half hour on this, or do you want to bring it to a vote at this point?
I move to lay the bill back to the next meeting.
Senator Scott, I'm not giving you a choice. Even we will lay this back. We're at a hard stop at 12:30. That was why I kind of wasn't going to bring it up, but we are at a hard stop, and we made a commitment to do that. This bill will be laid back and be brought up at our first corporations meeting, teed up and ready to go. We'll replow a little bit of ground and go right back to it. But with that, we're going to sign off and call it good, because we made promises, committee chairs, that we would go no more than 4 hours. So last final comments maybe on the committee, and then we're going to sign off.
Chairman Driscoll, could you stay on just for a few minutes so I can clarify votes with you, verify votes with you?
Yes, ma'am. I promised you I'd do that. I'll
Thank
be there.
you.
Senator Scott.
Mr. Chairman, I'm going to request Insurance Department to get with me and so we can figure out an amendment so that it'll make it more like the Nebraska system. And I want to also talk with them about some further consumer protection amendments.
So done. Mr. Ruda will get with you, I'm sure.
Senator Scott, look at House Bill 7 as well.
Very good. Thank you, committee. I'm going to hang on real quick with my chairman or my staff. So